Good morning. I'm Gordon Smith, the state's Director of Opioid Response. On behalf of Governor Janet Mills, it's my pleasure to welcome you to the third annual Governor's Opioid Response Summit. Our convening today is very timely. Many of you awoke this morning to the news from the federal government yesterday that in 2020, last year, that over 93,000 people lost their lives to overdose death. 504 of those individuals were from Maine. And we remember that loss and acknowledge the families and the sons and the daughters and the brothers and the sisters and the parents of each and every one of those individuals. The governor will talk more about that in her address at 11:30 this morning. I have a few housekeeping announcements, but first let me say that we are mostly virtual today, and I say mostly because I want to acknowledge that at 14 community recovery centers across the state that we have friends and registrants and colleagues gathered to watch this summit and participate in this summit together. The recovery centers are a very important part of our opioid response here in the state of Maine. I sincerely hope that by next year's summit, which, by the way, and you'll want to write this down, on Monday, July 11th in 2022, I anticipate an in-person event at the Cross Insurance Center in Bangor, Maine. And at that time, we will have either a community recovery center in every county as expected and intended by the legislation that recently passed, or we will at least have a planned location for a recovery center in every county. I want to particularly welcome our 15th recovery center in Ellsworth, and I appreciate the work of Healthy Acadia in getting that up this month. These centers range from Portland to Calais, over to Caribou, down to Bridgeton, and again, they are a very important part of our response. We have a lot for you today. We have 12 breakout sessions. We have 6 poster sessions. Those 12 breakout sessions were chosen from over 60 presentations that were submitted, and I am very appreciative of all of our presenters. There will be 3 streams and the 12 breakout sessions are in 4 groups of 3 streams each. So if you click on the agenda, you'll see which breakout session is in each stream, and you can click on that stream and move from stream 1 to 2 to 3. This is particularly important as we go through this morning's schedule because Attorney General Aaron Fry is presenting live from the Bangor Area Recovery Network in Brewer, one of the oldest, longest running recovery center in the state, and he will be in stream 2. So you'll want to move. There'll be about 10 minutes available right after 9 for you to move to stream 2, and then following that, which stream you're in will depend upon which breakout session that you're interested in. In the way of housekeeping announcements, everyone who's registered will receive a copy of Aaron French's memoir, Finding Freedom. In a very short time here, you'll be watching an interview between the Governor Mills and Aaron French. We originally said that the first 800 registrants would get a copy of the book, but we have almost 1,200 registrants, and anybody that wants a book will take care of that. I want to remind you that on September 28th and 29th is our Maternal and Child Health Substance Exposed Infants Conference. It's again virtual this year, with the keynote speaker being Dr. Stephen Patrick, and registration will be available soon on the AdCare website. For this conference, your evaluations will be sent out on Monday, and those of you who need continuing education credits will be able to, you'll receive those credits once you return your evaluation form. The summit will be recorded. Everything today is recorded, as was the excellent panel last night following the movie screening of the movie Jacinka. And you'll have access to that, and for several weeks, and we will send you a link to that recording. With that, I'm going to turn you over to my friend Nirav Shah. 2 years ago, when we were all gathered at the Augusta Civic Center, Commissioner Jean Lambrou and I had an opportunity to introduce you to our new Public Health Director, the Maine Center for Disease Prevention and Control, Nirav Shah, who at that time was coming from Illinois. It's been quite a ride these 2 years for Dr. Shah, who's both a physician and a lawyer. He now needs no introduction. He is one of the most recognizable figures in Maine. I was thinking as I prepared this introduction that I have been in healthcare in Maine in my 2 positions for 44 years, but I don't have a candy bar named after me. I don't have people wearing T-shirts with my most significant quotes. I don't even have a fan club page on Facebook. Dr. Shah has all of that, and it's my pleasure to welcome him here this morning, and I will put you in his good hands. Dr. Shah.
Thank you so much, Gordon. Very kind of you. Well, thank you so much, Gordon, and good morning, everyone. It's an honor to join everyone today to continue the important, timely discussions around substance abuse and its impact here in Maine. I'd like to thank everyone for taking the time today to join us and participate in this important conversation. We're convening at a time when deaths related to opioid overdoses have risen across our state and across our country. As Gordon just mentioned, there have been 504 deaths in Maine related to substance use overdoses last year alone. This comes on top of yesterday's news of 93,000 such deaths nationally, both of which represent roughly a 30% increase, both of which are sadly on a trajectory that is increasing and not decreasing. What I'd like to do this morning is talk a little bit about darkness and light. For the past 16 months, COVID has cast a long, dark shadow across the state. It plunged people into this darkness through its imposition of social and physical isolation on so many of us. Now, to be sure, isolation can save lives if it means that an individual isn't spreading COVID throughout their community. But today, we must recognize that that same isolation, that living in the shadows, amplifies the struggles of those who depend on others. Isolation, though it may protect us from a virus, exposes us to other risks, particularly among those who are vulnerable to substance use disorder. Substance use thrives in those shadows, in the periphery, at the margin, where people are unseen. As with so many things, one antidote to this darkness is to shine a light that can show the way to the help for people who are struggling with substance use. That is our goal today, to shine a light into the corners that have been darkened during COVID, to bring a brightness to those who have been struggling in those shadows. COVID has shone a light on these structural inequities the structural inequities that we always knew were around us, much in the same way that the opioid crisis does, and really almost every public health crisis before it, such as HIV. All of these crises affect those who live in the margins, those who are in the shadows. All of these crises demonstrate the importance of remaining connected with each other and what can happen when those connections are frayed. All of these crises also show that our response to them can't be static, that we have to move as the challenge moves. And all of them, I think most importantly, remind us of what we owe to each other. Simply put, each of these crises highlights the private challenge of a public health emergency. We, all of us, struggled in our own ways. And in the context of today's conversation, it's important that we recognize that that struggle made things that much harder for people who found themselves in private, in isolation, without the supports that they may have otherwise had during this very difficult time. Now, substance use differs from COVID in many ways, insofar as that it's not a virus. There's no lab test, and there is no vaccine. But what I think is important is that the tools that Maine used to come together in our response to COVID are just as instrumental for epidemics like substance use as they are with infectious diseases like COVID. The tools that we used, the tools that allowed us to come together at our core rather than fall apart at our seams, are just as critical as we redouble our efforts around substance use disorder. These tools reminded us that we have to rely upon one another, that none of us is an island, and that we each have a role to play in lifting each other up. Indeed, the format of today's summit is a stark reminder of this challenge. We come together today, but most of us are in different places. The isolation, the disconnection, the disruptions in our support chain did not end with the close of the state of a civil emergency. We're in the process of reconnecting, but it's still different and still difficult. What gives me hope, though, is that Maine's response to COVID has shown that we can do hard things. In fact, we can do more than one hard thing at the same time. So it must be with our redoubled response to the substance use crisis. In the last 2 years, even amid the pandemic, we have embraced harm reduction, a proven model to help people live healthier and safer lives. We more than doubled the footprint of syringe service programs across the state, going from 7 to now 15 such certified programs. They now serve a wider swath of the state and offer a wider array of services. For example, many SSPs now distribute Naloxone in addition to syringes. And we've worked with SSPs to strengthen their referral networks so that when people are ready to make a change, we are here to help them. In addition, recent legislation signed by Governor Mills will eliminate criminal penalties for the possession of needles, further destigmatizing those who are taking steps to reduce the harm to themselves and others. Another way that we shine a light on what's happening is through broader use of fentanyl test strips. They will, under that similar piece of legislation, no longer be considered drug paraphernalia. It's akin to giving people a flashlight in the dark, allowing them to see what's in the substances that they use. Now, no doubt there is more to be done, and today's summit is an opportunity to chart that course. To help us further that discussion, it is now my pleasure and honor to introduce the next portion of today's program, a conversation between Governor Janet Mills and Aaron French, author, chef, and owner of the acclaimed restaurant, The Lost Kitchen, in Freedom, Maine. Now, the theme of this year's summit is prevention, perseverance, and promise. And so it's fitting to have these two native Mainers share their conversation around these topics. Both Governor Mills and Aaron grew up in rural Maine, sharing a goal of overcoming the challenges that come with rural life, and both eventually finding their place in the very hometowns they grew up in. Both have faced obstacles to reach the levels of success they have achieved. Aaron has experienced the ups and downs of life in very vivid, public ways. And as you'll hear her say in a moment, life is not always a straight line. She found strength in herself and in her community. And her memoir, Finding Freedom, details with grace, humor, and candor the struggles that she and many Mainers face, particularly with respect to substance abuse. It is my honor to introduce you to these two pioneering women and share their conversation.
Hello, this is Governor Janet Mills. I'm here with Aaron French at The Lost Kitchen. And I want to thank you, Aaron, for participating in our Opioid Summit. And thank you for sharing your story by book, by interview, and helping us combat substance use disorder in Maine. Let me start by saying, look, you and I are of different generations, but we both grew up in rural Maine. I in Farmington, you in Freedom. But I noticed reading your book some of the same things that I could remember growing up in Farmington were occurring to you growing up here in Freedom. And some of the things that led to changes and challenges in your life were probably some of the same things that myself and friends of mine and my peers encountered in their lives growing up in Maine. You shared intimate pieces of your life story in this book, which I think is fantastic, and how you turned during dark periods in your life to prescription drugs and to some extent alcohol, wine, etc. Tell us how you might advise anybody else growing up in Maine or in Maine about confronting those dark times and how you might avoid, how another person might avoid getting to that dark place involving prescription drugs.
I think what you really need to find is your village. It's like when you go to elementary school and you have to fill out your emergency contact form. I think everyone should have an emergency contact form for themselves at any time, of people you can reach out to or people who are checking in on you, that you have some checks and balances, that when you're having dark moments, that you have people that you can talk to and feel safe with and that can help pull you out, because it's not something, I think recovery isn't something that can be done on your own. It takes a village, and it takes a huge amount of strength and help from others to lift you up from those deep, dark holes.
You talk about that in your book too, how it takes a village. And you talk about your women friends that came around and helped you start The Lost Kitchen. And I thought there were wonderful passages about that. And how the passage of time alone helps cure some of the loneliness and isolation that leads people many times to using prescription drugs. But can I back up a second and ask you about, you mentioned in passing that the prescription drugs you got kind of hooked on were from a doctor or several doctors.
Yeah.
Was it real easy to get those pills in the first place? Or, you know, I've always been concerned, we're all concerned about the ease of access to opioids, opiates, and prescription drugs in particular that become habit-forming. Can you tell us a little bit about that?
Yeah, that's the scary thing, is that I became addicted to prescription drugs that were prescribed by a doctor, and it was far too easy. And I wasn't under what I would consider great care. And that's another part of your village that I think needs to be important. You need to have a doctor that is checking in on you, not just someone who's writing prescriptions and thinking that that's the cure-all. because that's what happened. I was written a prescription, I went away. There was never a check back in unless I came in and said, I'm still having it, and then she would up it, the dose would get upped, and let's add another one in, and before you know it, a Xanax has turned into Klonopin because I've become immune to it, and then there's hydrocodone, and there's everything else, and mood stabilizers, and depressants, and it just became a very slippery slope. So that's a hard place to be when you think you're under professional care, and maybe that care wasn't up to the standard it should have been.
Did you develop a tolerance for these pills? And then there was alcohol as well, which made things feel better for a bit.
Well, the pills had their own way of creating this addiction, and then making you crave alcohol and making you want to drink more of it, and then feeling the effects were elevated because of the drugs, and it just became a toxic soup.
And you found refuge in food, and actually salvation in food. And you've been brought up in a small town restaurant, helping your father and learning to cook. Made me think of when I was a teenager working in a sort of a small restaurant in Farmington, and where everybody smoked cigarettes and they went for beers afterwards and whatnot. But it was kind of still a confining life, and there was a lot of isolation in some of these small towns. An element of boredom when you're young and in a rural area. And the effects of gossip, town gossip, which can be terrifying for young women in particular, I think. Maybe young men as well, don't know. But confronting these issues without resorting to prescription drugs or other drugs or alcohol. Any advice that you could share about how people can find enjoyment in life and deal with the isolation and loneliness and boredom? How can people better deal with those challenges of rural life without resorting to prescription drugs, alcohol, etc.?
Well, I think it goes back again to your village and having those friends and keeping your mind occupied with being able to socialize, which I know has been hard over the past year and a half, and that's been taxing on a lot of people. And it's hard being here when it gets dark at 4:30 some days, and so really finding passions and getting outdoors. That's one thing that really helped me, and I think even the moment when I knew I needed to adopt a dog because I knew the dog would get me outside.
Penny.
Yeah, that would get me outside, and I'd have to take her for walks, and I'd have to get that fresh air. And there's something about just getting outside, and it's such a great place to get outside, even in the winter, to go take a walk or skate or do whatever you can to just get some fresh air, because I think there's a lot of healing power in fresh air.
And food becomes an act of love too, and I think you said something about food is love. Why shouldn't hate get a meal too? You turn to food during bad times and good times, and food bringing back moments of nostalgia, and presenting that food and those lovely meals to other people to help them remember good things in their youth. I thought there were some lovely passages in your book about that. It reminded me of Nora Ephron's book, Heartburn. She wrote many years ago, when she left her husband, and at the end of every chapter there was a recipe. So you had some great cooking hints. I made a note of some of them, like how to stretch clams into rings so they spread out in the fryer, and try to let the excess flour drop off before you put them in the fryer so you don't clog up the... It was good stuff. So I learned a lot from your book on many levels. And making wedding cakes when you were going through a bad marriage, and think of the irony, and developing a sense of humor about that, I thought was fantastic. Not fatalism, but the irony of making wedding cakes for others who are hoping to have a happy marriage, and you're having a lousy one at the time. and work as therapy. The pandemic, you mentioned that earlier, and I'm curious to know how your business and how you and your relationships and your village survived the pandemic and have made a comeback now.
Well, that's the thing. I think I've had some practice with resilience, and I've had some practice with falling down and picking myself up. And again, that's life. It's going to always knock you down in places. And you're lucky if you have a good, straight, happy, even life. But you have to be prepared for those moments. And for us, I feel like we were ready. And we're also Mainers, and we're used to having struggles, and we're used to cold winters. So we just picked ourselves up and shook ourselves off and kept going and kept finding other ways to reinvent ourselves and stay agile. And we made it through, and we're still here.
Did you do takeout and curbside pickup like a lot of restaurants did, or?
No, we started an online farmers market so we could help move local food. And then we started doing lunches outside and moved into dinner outside, and then just got back into our first indoor dinner this past weekend. So.
Oh, good.
Yeah.
What are you serving?
Oh gosh! Oh yeah, 12 courses or so.
Oh, wow.
Yeah, we did it, and we had big long dinner, about 5 hours long. So
my
it's like
God.
we're gonna celebrate. Missed all that
breakfast.
time.
You talk about getting back to respect yourself, and the really hard times you went through, being isolated, going through a terrible divorce, losing your son for the time being, and the person you loved the most, being conflicted with your family, certain members of your family, and coming back to you bought a dog, you found a dog, and then you found the Airstream, and suddenly you sort of forgave yourself. Can you talk about what that was like, getting through a rehab period, which had its own problems, obviously, and then fighting the insurance company over paying for rehab, something we've got to acknowledge and confront. About finding yourself again and forgiving yourself and the child in you. Can you talk about that a bit?
Yeah, it's, I got to a point of going through those hard times, and between the addiction and just the fall down of my marriage, and feeling like a loser of a human for a bit there, and I had to get to a point to accept that my imperfections were part of me, and that they were maybe growing me, and that maybe through the darkness that there could be strength that could be gained. And that's what I found through all of these dark moments that I've had. I was able to find a way to look back and almost celebrate it, because it was a part of my story, and it was shaping me. And I've always felt like you never make great bounds when you're just having an easy day. It's the hard times that grow you and make you a stronger person. So yeah, it was taking that moment to forgive myself and look back and celebrate that sort of story.
And that's a great message. I think people who are in the dumps, down in the dumps, and addressing their problems with sort of escape valves and with drugs and alcohol, being able to forgive yourself and move on. And I think work was therapy for you, don't you think?
Oh yeah.
Food and work.
Yeah, to just throw yourself into something, to have something positive. If you're having a negative time, and for me, I was just, in the deepest ditch, and didn't know some days how to pull myself out of it. But to have something to pour myself into that felt positive, that felt like it was doing something and making a positive difference. And for me, that was cooking and making beautiful meals for people. And I really poured myself into that. So I think that's an important thing, to find something you love and just throw yourself into it when you're feeling down and dark.
You found it helpful to help other people with food, it seems to me, with the meals that you prepared so lovingly, so carefully. Seeing the joy in other people's eyes and in their enjoyment of the meals you prepared.
Yeah, that really filled up my heart, to be able to feel like I was doing something right, and to be able to offer other people joy was filling me up, and I had a giant deficit, so to be able to have those delicious feelings were something that propelled me.
And you talk about hearing the bad things too, and how you have to get over listening to bad people, listening to bad comments, and somebody gives you a bad review or something, and saying, you can't take that to heart. That's tough. That's got to be tough. When you pour yourself into making a meal, and most of the people are loving it, and one person says something bad about it. How do you accept that? How do you move on from something bad like that?
Well, that's taken time. I used to have moments when I would just bawl my eyes out and curl up in the fetal position. But it's really taken time of establishing confidence in myself. And so now when I hear those reviews, I listen to it and I say, is there anything I can learn from this? Are they saying anything that is honest and true and matters? And if there isn't, then I just shove it aside and say, just brush it off. But it's not something that comes overnight. It's something you have to build up that sort of Teflon strength to over time.
Wow. That's a hard lesson to learn.
Yeah.
A hard thing to do. And you talk about how drugs helped you with anxiety. You said you had, and even after rehab and after coming back to Maine, the drugs had once helped you fend off the nervous twinges and suffocating attacks. They were no longer there to see me through an episode. I'd quit the drugs, but the anxiety hadn't quit me. I could still feel its strong grip. start by squeezing my lungs and tightening my breath. I'm getting dizzy reading this.
I'm feeling it.
And then an inevitable layer of invisible bricks would begin to pile up on my chest. Then feelings of fear and doom. Okay, I don't want to get too far into this, but so what did you do to overcome those feelings of anxiety and fear and doom and some of the worst moments after going through a period of rehab and coming back to Maine?
Well, there's lots of practices, and nothing was easy, but really practicing breathing and just taking your breath, and also recognizing the power of your mind to change things, and the power to really think and go deep and say, you have the power to change your mind and to change your feelings. And that was always something that I would remind myself, that my mind was stronger than I thought it was, and to remind myself of my capabilities. We're in our 8th season now, 7 years in, 8th season, and it's just become stronger every year. And that's the thing. I mean, the restaurant has grown and it's become wild, and we never asked for this push, for it to become what it's become, but it's pushed us as women, and it's pushed us as people in our community to keep rising. And so that's been powerful for us to, as we keep rising together, we keep holding each other's hands and lifting each other up.
I know there are a lot of people out there who've gone through something similar to what you've gone through. Thousands of people in Maine go through bad divorces. There's no easy divorce. People fight over custody. People fight with people they once loved. And not everybody finds a lost kitchen, of course, or has a wonderful innate talent you grew up with, and then expanded on as an adult. Talent of cooking and serving food and finding the most delicious flavors and scents. You've talked about finding a village, expanding the concept of family, essentially. What other advice might you give young people in Maine or elsewhere who may not have the wonderful talent you have, but who might have other roots and joys that they could reach out and find?
Well, I believe that everyone has some innate talent within them. I mean, I didn't go to cooking school. I grew up in a rural diner, and who would have thought that I'd be doing this? And so it was really about finding a passion and pouring yourself into it. And I think whatever that is, if you find that bit of something that drives you and you put every ounce of your heart into it, you do become talented at it. And so this was something I didn't start to look at becoming a full-time cook until I was 30 years old, and I started to pour myself into it and said, maybe I'm good at this. Maybe if I love it enough, I could do something great. So I believe that everyone's got a little something. And putting my roots down here and saying no a lot, saying no to growing, saying no to expanding, and saying it's perfect just the way it is, and I'm going to do everything I can to protect it and maintain balance. And balance is a lifelong struggle. It's something you have to keep checking in on every day, and it's something that I continue to struggle and work with. So yeah, continuing to check your balance.
Well, it's been a pleasure talking with you, Erin. I just love that you've not only been successful, but that you've been so truthful and honest about your own life, your personal life, and your professional life, that you've become a role model for many, I have to say, that you've shown people how to live your dreams, even during the darkest of times, not forgetting your vulnerabilities and your dreams, and elevating your aspirations to be a success in life without falling back on prescription drugs or other crutches, as you've called them. Thank you so much for sharing that.
Thank you. I'm so hopeful that this just shares a bit of strength for anyone else who's going through this, and they can feel less alone.
It certainly will. Thank you.
Thank you. Thanks so much.
Good afternoon. I want to start by thanking every participant at today's summit, from the public servants to the community leaders, journalists, artists, and especially those in recovery who are fighting to end this epidemic. I tip my hat to all of you. And I appreciate Governor Mills's invitation to be here, and I want to thank her for her many years of friendship and support. As attorneys general, we shared quite a few foxholes together, fighting for the values of equality, justice, and opportunity for all. And now we continue the work that we did as AGs together as we take on the scourge and stigma of opioid addiction. I address you today at a critical moment for Maine and the nation, a moment filled with as much hope as hardship, as much determination as despair. and I address you on behalf of an administration committed to saving lives here in Maine and across America. The opioid epidemic has hit Maine and the nation hard, and since the start of the COVID-19 pandemic, the challenge before us has only become greater. The consequences of this pandemic went far beyond physical health. Faced with job losses and social isolation, many Americans experienced an increase in anxiety, depression, suicidal ideation, and yes, opioid addiction. Here in Maine, the 504 overdose fatalities in 2020 represented a 33% increase from 2019. Provisional CDC data forecasts that 90,000 overdose deaths occurred nationwide from September 2019 to September 2020, the highest number of overdose deaths ever recorded in a 12-month period. These numbers are heartbreaking, but numbers alone cannot capture the true toll of this crisis. It can be seen in the absence of a loved one at a dinner table. It can be heard in the quiet of a home in grief. It can be read in the obituaries of people with whole lives ahead of them and whole families left to miss them. But despite this difficult hour, we have reasons for hope. The state of Maine, led by your governor, in collaboration with experts, advocates, federal partners, and those in recovery, continues to respond aggressively to this crisis. In the 2 years since Governor Mills took office, Maine has invested in 160,000 doses of naloxone through public health and harm reduction organizations, resulting in the reversal of more than 1,100 opioid overdoses just last year. Maine has bolstered prevention efforts, such as the Self for Me pre-K through grade 12 emotional learning curriculum, which it made available to every school in the state last fall. Since then, more than 1,800 educators have registered for the program, and over 17,000 modules have been used by Maine students. And you've invested in medical-assisted treatment and trained 534 recovery coaches, more than double the original objective, of whom more than 133 are actively coaching individuals in recovery. That's just a taste of the work Maine is doing to turn the tide of this crisis. And I'm here to tell you that Maine is not alone. The Biden-Harris administration recognizes the scale of the behavioral health crisis and has made tackling it a priority. The American Rescue Plan, which the President signed into law in March, provides historic resources to take on this epidemic, such as the $1.5 billion for the Community Mental Health Services block grant that makes funds available to all 50 states. There's another $1.5 billion for the Substance Abuse Prevention and Treatment block grant, which will be used to plan, carry out, and evaluate prevention, intervention, treatment, and recovery support for individuals, families, and communities impacted by substance use disorder. In April, HHS released new buprenorphine practice guidelines that, among other things, remove a long-time requirement tied to training, which some practitioners have cited as a barrier for treating more people. And in May, I established HHS's Behavioral Health Coordinating Council for one simple reason: to act and to help our communities overcome behavioral health crises like this overdose epidemic, and help prioritize not only treatment, but long-term recovery for our nation. The Council will ensure that we are prioritizing and coordinating our behavioral health efforts in our budget, our agenda, and across HHS's agencies. So we stand shoulder to shoulder with you in this fight. Like everyone at this summit, we are committed to saving lives, healing communities, and putting an end to this epidemic once and for all. Maine's native son and the most important poet of his day, Henry Wadsworth Longfellow, wrote, "Perseverance is a great element of success. If you only knock long enough and loud enough at the gate, you are sure to wake up somebody." And that is what everyone here in this summit intends to do. We will keep knocking until the job is done. And make no mistake, we will get the job done because there are too many lives at stake to achieve anything less. Governor Mills, I thank you again for inviting me to speak here today and for your aggressive response to this epidemic. Your invaluable leadership is saving lives. And I hope at next year's summit, I can join you in person to share the exceptional progress we will have made in this grueling struggle. Friends, thanks to all of you for attending today's summit and for your critical work on this issue. Your community, your state, and your nation are indebted to you.
My issues with alcoholism and drug addiction became pretty apparent when I was 19. I had gone off to college. There was probably like a 3 to 5 year span in Massachusetts where opiates just flooded the street and everyone was doing them. I hopped on that train. I'm not unique in the sense that I would draw lines in the sand. Things that I said I would never do quickly became very common behaviors for me and common decisions I would make. I went to various groups, partial hospitalizations. I did go to AA meetings, and it was intimidating. It was intimidating to me, the work that I was going to have to do every single day for the rest of my life if I wanted to have any semblance of a life or quality of life, if I wanted to have a future. So I would convince myself that this really wasn't my problem. I just got caught up in circumstances and that I was not a true drug addict or alcoholic. So I ended up relapsing. And when that happened, I can tell you, I've been in a lot of really awful situations. I've been homeless. I've been incarcerated. I've been cut off from my family. Had some pretty crappy situations happen. And this point, I relapsed after having a job, after having everything I thought I needed to stay okay, and it still didn't work. I felt completely done and empty. I felt like a zombie inside. And hopeless doesn't even begin to really describe what that feeling felt like. So what happened is I was recommended to go to a 12-step based treatment center, which was pretty different from anything I had done before. And it was suggested to me to go on to sober living. That was another something I really did not want to do because I had done it before and it failed and it was awful and dirty and all these things. So against my own advice, I took a step of faith and, listened to what these people were telling me that seemed to have a good quality of life and seemed to actually care about me and who I was and maybe who I could be. And, it was hard. I moved states away from my family. I knew no one here. I had nothing. I had no money in my savings. I had a bag of clothes, and I was petrified of everything. I was petrified of being sober, and I was petrified of relapsing. And I took it really, really slow. I believe recovery is basically this pretty large-scale swapping of ideas. I had certain ideas about, myself, my life, the world, my place in those two things. And, come to find out, I didn't really know what I was talking about. And I was holding on to these ideas really tight, like a life raft in the middle of the ocean. And I refused to let go of them for a long time. And so I started doing things that were really, really uncomfortable for me. I started praying. I'd never done that before. I started meditating, and I felt super weird about it. And, I started volunteering and caring about other people, not having myself and how am I going to get what I need out of this person, out of this day, out of this situation be my first thought when I wake up in the morning. This was all very, very foreign to me. I live in a place that I am capable of paying for. I have friends that know if I say I'm going to be there, they can depend that I'm going to be there. It's crazy. I'm employable. People recommend me for things, and I care about people, and I'm good to people, and I can say that with confidence and know that it's true. All of these things would not have been even a flicker of possibility if I hadn't taken suggestions and listened, and done some stuff I didn't want to do. My recovery and my life really is based off of the 12 steps. That was really kind of what shifted my perspective, and it was uncomfortable, and sometimes it continues to be uncomfortable, but that's okay because I know that I can get through that and that I can help others do the same thing. So yeah, I'm just perpetually grateful and still taking it day by day.
Good morning, everyone. I am Brad Page. I'm president of Kennebunk Savings Bank, and I'm here today. I'm joined by Shannon Bresaw, who's the director of the Governor's Recovery Friendly Workplace program in the state of New Hampshire. And I'm also joined by John Burns, who's the director of the SOS Recovery Community Organization with offices in Dover, Hampton, and Rochester, New Hampshire. And we're here this morning to talk about recovery-friendly workplaces and stigma reduction. And I am a big proponent. I am very hopeful that this is a program that we can bring to the state of Maine, either through the government or perhaps through the private sector as well, if there might be a way to do that. So, but I'm a big proponent of it, and what we're going to talk about today is the Recovery Friendly Workplace Initiative in New Hampshire. Shannon will talk about the framework and some of the details of their program, and then John will talk about the recovery programs and recovery centers and their role in the recovery friendly workplace. So without further ado, I'm going to turn it over to Shannon.
Hi everyone, thanks for having me today. My name's Shannon Bresaw and I work for Granite United Way in New Hampshire. We are the largest United Way in the state of New Hampshire, and we cover about 80% of the state. As part of that role, I work closely with the governor and the Office of the Governor for the state of New Hampshire to administer the Recovery Friendly Workplace Initiative. So this initiative was launched by Governor Chris Sununu in 2018. When he came to office in 2017, we were in the midst of an opioid crisis. We had seen a dramatic increase in overdose-related deaths from 2012 to 2017. And the governor really wanted to address the addiction crisis, and he wanted to think of some innovative ways to do that. So his background is in the business sector, and so he looked at how the business sector could get more involved in addressing the opioid crisis, and he used his experience as a former CEO to think through how employers could be of assistance to employees who are struggling with substance use disorder or have family members impacted. And so in March of 2018, he launched the initiative, and we started off with about 25 early adopter businesses, and these businesses had been implementing wellness-related initiatives within their workplace. And so they were really primed to be part of this initiative and to really be champions for this initiative. Since 2018, we have grown to now over 285 workplaces that are engaged in this initiative in New Hampshire. So we've seen significant growth in just a short amount of time. The premise of the initiative is that we are working to create environments in the workplace that are conducive to supporting people. So supporting people who are impacted by substance use disorder. So that's pretty much everyone. And so for folks who have a substance use disorder or are in recovery, have a family member, this initiative looks to connect employees to the resources that they need and to challenge stigma that we know has a significant impact on people and employees within the workplace. So one of the key aspects of this initiative is to challenge stigma, and we do that in a variety of ways. We'll talk a little bit more about that in the presentation. It was also really important to the governor that we were focused on employee retention and productivity. And so one of the aspects of this initiative, and you know, employers often ask, why should we get involved in this? And employers and workplaces get involved in this type of initiative for a number of different reasons, and oftentimes it's not related to the cost savings that they can that can result from an initiative like this. Oftentimes, businesses and workplaces are just very dedicated to their employees, and they want to support their employees in whatever way they can. And so, you know, work is where we can reach a large number of people. So being able to engage with folks in that setting allows us just a greater opportunity for impact. So we do know in New Hampshire that we have an annual cost to our economy of about $2.36 billion in costs related to substance use. And so those are costs that primarily impact the workplace. So costs associated with absenteeism, with productivity losses in the workplace. And so we do know that there are costs to employers. We also know that when employers are encouraging folks to seek recovery, and when folks are able to maintain recovery, that there is a cost savings, you know, of an average of over $8,500 in cost savings. In addition, we do know that people in recovery miss far fewer days of work than someone obviously with an active substance use disorder. So we do know that there are some cost savings there, but we also know that it's important to value our employees and the talent that we have among folks in the workplace. And so, you know, you're saving costs on not having to, you know, rehire these positions, not having to do all the recruitment, but you're also keeping someone on staff who is a loyal, hardworking, dedicated employee. And so just like any other chronic condition, you know, you are working to make adjustments for staff and to keep them on board in the workplace. We also know that, and I didn't mention this, but in the last slide, we know that approximately 10% of the population has a substance use disorder. So for employers that will sometimes say, you know, we don't have that issue in our workplace, we know that, you know, you're already employing people who have been impacted by substance use disorder. And so that often results in us working with that business kind of along a continuum of readiness. And I'll talk a little bit more about that as well. So when we started this initiative, it was very important that we were connected to the Department of Business and Economic Affairs in our state. They oversee a lot of the workforce development funds that come to our state, and they're also responsible for promoting the business sector in our state. And so we were very closely connected with them. There was some funding that came through them. And so I work really closely with them as well as the governor's office. We have an advisory council that has members of the public, treatment representatives, recovery representatives, folks from the business sector who are all part of the advisory council. And they provide really broad oversight and strategic direction for this initiative. When we started, we had 3 recovery-friendly advisors on staff. We've now grown that to 4 advisors, as well as a full-time assistant director. And the important items in this organizational chart, from my perspective, are at the bottom, where you see the resources that are in place to support the workplaces. So we partner with the existing infrastructure in the state of New Hampshire, which includes 13 public health networks. It includes, I think, about 17 recovery community organizations. And so rather than go out and recreate the wheel, we are investing and supporting the existing infrastructure and connecting them to this initiative. So when we were working with Governor Sununu to develop this initiative, it was really important to him from the business perspective that the process was as simple as possible. So he insisted on a one-page checklist, and this is really the framework of our entire initiative. And so everything that encompasses this initiative is on this checklist. And these are the steps, and we've tried to make it a simple but meaningful process for businesses. So we had a combination of, keeping it simple for the businesses, but also looking at the research on best practices and what's going to be effective in creating wellness opportunities in the workplace. So one of the things that we do in the first steps is businesses who are interested in this initiative will send a letter of interest into us. We then go out, do an orientation with that business, and we require that senior level leadership of that business is part of that meeting. And then we ask the business to make a declaration to all of their employees and really stating their commitment to this initiative and what this initiative means to their organization. And the reason that's really important, we talk about challenging stigma. That is the first step in challenging stigma. If I'm working for an organization and my president and CEO makes a statement to all of the staff and that they are committed to supporting people through their recovery, that they're willing to make adjustments to work schedules, or they're willing to look at how they can create environments that will be supportive and get people connected to resources, that's going to make me a little more comfortable coming forward with any concerns that I have around my own recovery. And then here's some of the other steps, and really the key components are getting businesses connected to the local resources that can help support their employees. So that includes recovery organizations, which you'll hear more about this morning, getting connected to trainings that we offer, and really employees need to know where they can go to for assistance. And then we have some other optional activities, but on an annual basis, we renew the designation, and the governor makes that designation and certifies the businesses that are part of this initiative. So the way that we support our recovery-friendly workplaces is really on a one-on-one basis. So we customize this approach depending on the size of the business, the industry that they represent, the culture that already exists within their business, and really the readiness level of the business. So oftentimes, people come to this initiative for all sorts of reasons, and we really work with them on a one-on-one basis to understand what they're looking to achieve, and we work to bring them the resources to help them achieve those goals. And each business is assigned a recovery-friendly advisor, and that is kind of their point of contact. They have one point of contact, and that point of contact connects them with all the resources and supports that they need. We have developed a number of trainings through this initiative. We started off by offering a number of in-person trainings, so everything from understanding substance use disorder and how to access resources, how to save a life with Narcan. We started off with all in-person trainings, and then when COVID hit in March of 2020, we realized we needed to pretty quickly convert all of our trainings into a digital format. And so we were able to do that. And so here you see the in-person trainings we offer, the online trainings, as well as additional online trainings that we have developed in the past year to really meet the needs of businesses. And that's what we try and do, is to really meet the needs of the businesses that we serve. And so when they ask for more resources around mental health, we look to partner with the experts in that field to bring them the trainings that they need. When they asked us last year for more resources concerning diversity, equity, and inclusion and how that relates to recovery, we were able to create a training for that as well. All of our trainings that are online are now in a learning management system, and this offers us the ability to really track the progress and offer pre and post surveys and really track the outcomes of these trainings. So one of the things that's really exciting about this initiative is the interest that has been shown across the country. And actually, even further than that, we just did a training and a presentation for a group in Canada at a university. There is widespread interest in this initiative. And so we've partnered with over 25 states to really share all of the resources that we have. The governor was really adamant that we do this because we know to impact stigma and to really be effective with this initiative, it needs to be a movement. And so we need to share whatever resources we have, and we've been able to do that. We recently developed a community of practice, and you can see here which states were represented in that group. And this is an opportunity, and we do this through Zoom, for states to really learn from one another. Because a lot of states are implementing aspects of this type of initiative, and we're there to offer any technical assistance and support that we can, being the first in the country to really launch something like this. We have a number of different assets that we've been able to create. We have some promotional videos, but one of the most impactful assets that we have are actually our businesses that are part of this effort, because they see firsthand the impact of the trainings and all of the programming and all of the work that we do with this initiative. They see the impacts, and so they're able to talk and share their results with other businesses, and we really see our business champions as key to promoting this effort and to the success of this effort. We have a number of one-pagers. As you can see, everything is really branded with our colors and our logo. And again, we are willing to share all of this with any state or group in the country that's looking to replicate this initiative. We have states that are really just taking our stuff and putting some local flavor into it, and but using our logo, and we are absolutely fine with that. Again, we want to see this replicated. We don't want people to have to, do all of the work and recreate the wheel. So just in summary, our key accomplishments that we've seen over the last 3 years, we have a full staff. We've been able to secure some funding to have a team to be able to address the capacity and the interest that we've had in this program. So we have one part-time director, and that's the role that I serve in, full-time assistant director, and then 4 recovery-friendly advisors, and those are the ones that are assigned to the growing number of businesses that are part of this effort. We are engaging 285 workplaces representing over 71,000 employees in the state of New Hampshire. You saw the trainings that we have created. We have a significant number of businesses that have taken advantage of those trainings. We're connected to a number of other states. And one of the most exciting things that we're doing right now is we've just received funding to be part of the New Hampshire Service to Science process. And that is a process in New Hampshire that's focused on prevention and looks to evaluate initiatives like this and determine if we can work towards becoming a promising practice. And so that is underway right now. We have a business survey that will be going out in September to all of our businesses. So we'll be able to really collect a lot of good data to hopefully be able to show the impact that we are hearing anecdotally from the businesses that we serve. And I'm going to hand it over to John to talk a little bit more about the direct recovery supports that are part of this effort. Thank you.
Thanks, Shannon. Good morning, everyone. My name's John Burns. I'm a person in long-term recovery. I'm also a family member. I have a daughter who's in recovery as well, and I am the director of SOS Recovery Community Organization. And we were one of the organizations that worked as in partnership with Granite United Way and the Recovery Friendly Advisors, which was a really important collaboration. And one of the things, before I get into some of the work we did, is one of the most important pieces to this that I identified when we first started getting into it is we know, those of us in the recovery community, it's important to really build recovery-oriented systems of care, and working with employers, especially around the issue of stigma. This was a critical thing, because we know, those of us in the recovery community are all too aware of the stigma around substance use disorder and people struggling with addiction. And we also know that most people struggling with substance use disorder are not as they're often portrayed in the media. They're not necessarily intense. They're not necessarily homeless. Most of them are in the workplace. And so it was important to us to start working with employers, because we know we can reach more people who are struggling today, and provide supports for not only them, but for their family members, which is also a critical path as a family member. So one of the areas, when we talk about recovery-oriented systems of care, it's really a holistic approach, because years ago, before this model was built, recovery really focused on the treatment side. So it was always a model where clinical care was viewed as the primary resource, and that has changed, because we now know that recovery requires a holistic approach that goes well beyond treatment. That can be faith-based, it involves work, school, peer supports, housing, and people have to have their basic needs met. So working with employers, that's such a critical piece to that recovery-oriented system of care. And then also, as a recovery community organization, a lot of people oftentimes don't understand what exactly that is. So briefly, a recovery community organization is really just an independent, and in our case, a nonprofit, typically nonprofit organization, and it's led and governed by representatives of local communities of recovery. So a lot of the work we do as a recovery community organization are not just working with individuals, it's all peer-based, it's non-clinical. We carry out a lot of recovery-based community education and outreach programs. We do a lot of one-on-one peer recovery support services. So our staff will do one-to-one check-ins on a weekly basis with individuals that might be very brief. And we'll also do comprehensive engagements with individuals where it's a longer wellness-built program. And the recovery community that we engage with that are people in long-term recovery, their families, friends, and often allies as well, including recovery-focused addiction and recovery professionals. So it's really, when I describe recovery community organizations, it's about being kind of a centerpiece around recovery in the community and building it around the community needs. So oftentimes you can go to one recovery community organization in one community, it can be very different feel from others, and that's based on the culture of that community, which is critical to building out that system. And then, so how does that recovery-oriented system of care and a recovery community organization and a recovery-friendly workplace all tie together? And for us, that was really providing the local supports for the recovery-friendly advisors, for the initiative coming out of the governor's office and Granite United Way. And so as a recovery community organization, some of the things we provide regularly that tied in perfectly are telephone recovery supports and peer-assisted recovery. We have a criminal justice program. And for us, we met with a lot of employers who had individuals who might be involved in drug court, who might have some criminal justice involvement, and working with those employers to understand some of the barriers that exist for those individuals, and working with employers to break down those barriers. In some cases, we had employers who are super helpful with people in recovery that they had employed, and for them it was difficult because people would take lunch to go to a meeting, but the meeting lasts an hour and people would be driving back and forth. So how could we better support those employers locally? And in some cases, we brought meetings to the employer's place of business and held all recovery meetings, which supported multiple pathways within the employer's place of business. So it also involved providing resources, information. As COVID happened, we went to a very comprehensive digital recovery support model, offering 8 meetings a day nationally with 2 other recovery community organizations. We do a lot with family program. We have some parenting journey programs. So again, tying this all together for the family members and the individuals in workplaces was just a really important thing to do at a local level in collaboration with this effort. So when we started this, we were one of 5 grantees across the state of New Hampshire that implemented this initiative and worked closely with Shannon's team and Granite United Way. We specifically were serving Stratford County and the Seacoast. Oftentimes it extended beyond that, but that was our primary focus. And what happened was their staff, the advisors of the recovery-friendly workplace, those recovery-friendly advisors, were really closely linked to our center staff, so that as they faced challenges with employers and we faced questions, we were able to work together and make sure we provided support for those individuals, for the employers, for their families, and understanding that each workplace is very unique. So we had employers that were small coffee shops that had 4 or 5 employees. We had employers that had thousands of employees. We engaged with the University System of New Hampshire. So how we supported each of those businesses really varied, and one of the nice pieces was working with them on a local basis allowed us to really customize how we approached all of it, and some of those programs just really had a huge variance in how we provided them. So here in New Hampshire, as Shannon had said, there was over 285 New Hampshire businesses that were involved in this, and SOS was really involved with well over 150 of them, and we still are today. And that can be everything from dispatching. We had a manufacturer who we gave an 800 number so they could dispatch us if they had a crisis at the manufacturing facility with somebody who might be in recovery who was struggling. We had employers that we provided meetings on site. We actually wanted to really connect with the LGBTQ plus community, and there was a organization, a business who did a lot of, they're like a tea shop in Somersworth, New Hampshire, and they provided a lot of support to the LGBTQ community, so we brought all recovery meetings into that to really create an inclusive environment that we were identified within the LGBTQ community as a safe place to work with the recovery community. So there was a lot of different examples such as that we did, and as a result, it's just been a very successful collaboration where we've really connected well with businesses, with chambers of commerces. We're a member of 4 different chamber of commerces as a result of this initiative, and it's just been overall really rewarding to be a part of it. So some additional questions that we were often asked as I close here is, a lot of the employers would often ask our staff as we were working with them. We did a lot of outreach early on, and one of the big concerns that come to us is, do we have to hire people in recovery to be part of this? And the answer was always, we would love you to, but no, that's not a requirement. There's people, we know there's people in the workplace that are already struggling with their recovery, that may already have a substance use disorder. So let's provide supports for them and use that as a starting point. And if you decide down the road, we would certainly love to work with you on hiring people in recovery. Another one was whether they have to create or change policies. And again, the answer was no. So again, we will work with companies to do that, and we have in a lot of examples. But it's not a requirement to start changing. We're not looking to go in there and recreate the wheel. We're going in there to create a culture that creates a safe space for individuals in recovery and family members. And I think Shannon already kind of talked through the process of what it looks like, but maintaining that designation is really like the starting point is the hardest part, and really building a culture. And then it's really just a maintenance project, and hopefully we can expand on some of the stuff we did early on and build off of that and create a more friendly place for individuals who struggle with substance use disorder and their families. So thank you again for all your time. It's been a pleasure and an honor to be a part of this, and I will turn it back over at this point.
Thanks, John. So what I want to do is give a workplace perspective to the programs that they've both laid out for you. So I'll talk a little bit about Kennebunk Savings. I promise this isn't a big ad for Kennebunk Savings, but as Shannon mentioned, I think that each business that comes to the Recovery Friendly Workplace program probably comes from a different place. So I think perspective and context is important so that you understand where Kennebunk Savings came from and how we arrived at Recovery Friendly Workplace. So very quickly, 150 years old, mutual bank. We don't have stockholders. The key piece here, we have 17 branches, but we have 12 in York County and we have 5 in Seacoast, New Hampshire. We have a community of giving, so we give 10% of our net profit back, and you can see the numbers. So that's the position that we come from. We have a high volunteer base among our employees as well. So part of our overall giving program is what we call our Spotlight Fund. And we basically try to go out and proactively identify critical issues in the communities that we serve to target funding and target basically our efforts and our volunteer hours to that issue. So starting in 2018, and we actually carried it through for 3 years, we identified substance use disorder prevention and recovery as our Spotlight Fund recipient during that period. As you can see, we've given over $400,000 since 2018, and it had such an impact on the organization at a leadership level and right down through all of the employees that going forward, while we've moved our Spotlight Fund to another effort, we've actually made substance use disorder what we call a cornerstone of our overall program. So in effect, it's my hope that that'll live on in perpetuity. We'll always have that dedication to substance use disorder in our giving. So these are just to give you an idea. We've got a number of partners that we worked with that we gave grants to over the time period, and again even through 2021. I'm sure there's probably representatives from each of these organizations on the call, and I'm sure that you all recognize a lot of the other organizations that are up there. So we really felt like we developed became part of the community around substance use disorder. So our action steps, in addition, money's great. I always say money's great, that's great. We can give a lot of grants away, but what are we doing ourselves to take action around an issue, and particularly when we're talking about our Spotlight Fund? So just to give you an idea of a few things that we did, we offer Doterra drug deactivation bags in all of our branch locations free of charge to the public, and we also have them in our operations center for our back shop employees. If you're not familiar with the bags, basically if you've got drugs around your house from prescriptions that you need to get rid of, it allows for household disposal. You tear off the top, drop the pills in, add some water, shake the bag, and you can put it in the household trash. So we thought this was a really good, tangible way of evidencing our support for the substance use disorder causes that we were pursuing. We also, because of that slide you saw with all the logos on it, we also were able to bring a lot of those people together. 2 of them may look familiar on this picture, but we brought them together for a business forum on the opioid crisis. So again, for us, it's all about leveraging whatever resources are available to us to further the cause, and this was one example of it. And then also just leveraging our network. Obviously, like everyone today, we have a social media presence. So we actually developed a whole series of community education posts that we put out on our social media channels. And also we continue to repeat today, now and again, just to keep the spotlight on it. So after we did all of that work, obviously, when we take on a challenge like that, it's not all about external messaging and external things, but it's also communication with our employees. So all throughout those 3 really dedicated years of the Spotlight Fund, when we were concentrating on substance use disorder, our employees had great visibility to that campaign. So again, leveraging resources, so we had really good experience with the Doterra bags and other things, but we wanted to know how can we really bring it back into the organization. And fortunately, we had already developed a really great relationship with John and SOS Recovery, and he put us on to the Recovery Friendly Workplace Initiative in New Hampshire. And then just quickly a why. Shannon also alluded to it. My personal belief is if you're a company that's trying to develop an ROI around a recovery-friendly workplace, you're probably doing it for the wrong reason. In my mind, I think we all have a moral obligation, and I think companies have a moral obligation as well to improve their communities. And clearly, when there's an issue like this going on, we have that obligation to make sure that we can do everything possible for our communities and also for our employees. So that's really the direction we came at from Recovery Friendly. I'm sure there's probably hours savings or dollar savings. We don't measure them, and quite honestly, I don't really care what it is. For me, success is a healthy employee base. So you saw Shannon's sort of outline and checklist. So just to bring it home, practically what actually happened at Kennebunk Savings. We obviously had established a relationship with SOS Recovery Community Organization, but most importantly, and again, Shannon, I think John may have mentioned this as well, it is incredibly important that this initiative gets driven by the very top of the organization. This can't be an initiative from one or two people in your HR department or someone in marketing or wherever else. The direction has to come from the top of the organization. Hopefully you can tell I drive that. So the first thing we wanted to do was get the board of directors, my bosses, on board with it. And you know, it has to be, it's not just so this isn't just a board vote. I want them engaged and understanding what we're doing. So did the whole presentation on it. I had already talked about it for a few months anyway, so they knew we'd be talking about it. What I wasn't looking for was a vote. I was looking for head nodding and engagement around the table, and I'm happy to say, which I knew I would have, but we had really good success there, complete engagement by our board of directors, and a big go forward with the initiative. So next step, submitted the letter of interest to RFW, and then we met with SOS, so John and friends, as I call them, and Recovery Friendly advisors from Shannon's office to go over the RFW requirements. We actually have a social responsibility manager and department at the bank. So she refuses to be on camera, but Liz Torrance is our social responsibility manager at the bank, and she's awesome, and she has been such an advocate and champion around substance use disorder at the bank on a day-to-day basis. So we had that department and a few others meet with them to go over the checklist and figure out, okay, how are we going to get this done? HR obviously plays a big part in this, so we wanted to make sure we oriented the HR team to provide the RFW overview with them. I'd also mention that another key department, or two key departments, I just mentioned our social responsibility area, but also obviously our marketing department plays a big role in this as well in trying to get the message out. Next, we completed an orientation session. I don't remember how long it was. I'm going to guess it was about a 3 or 4 hour session that we did with our full board of directors. I had 100% attendance from my board there, my entire senior management team, and our HR department. Again, facilitated through the RFAs and the recovery staff. I mentioned a few things here: RFW definition, what is substance use disorder recovery, stigmatizing language, and a lot of other components to that training as well. But really good training. Everyone left, I can tell you, very enthusiastic about it. It's a real feel-good thing when you really start talking about these things. We introduced Recovery Friendly Workplace at a leadership meeting, so our quarterly officers meeting. Banks love titles. That's about, actually probably about 90 people or so. But basically the managers in the organizations and higher level people in the organizations, we introduced it there at their meeting. And then we got going on generating communications and resources for a company-wide launch. Resource documents, Shannon talked about. We used a lot of their documents for samples and customized them as we needed to. So this document, for instance, is actually in throughout our branch network, and for instance, employee areas, back shop, cafeteria areas, things like that. Our operations center they're all over the place on our operations center. They're in the bathrooms, they're everywhere. And basically, this gives a list of recovery and substance use disorder resources that employees can go directly to. Again, just a couple of them that are on there: 211 in both states. In Maine, Portland Recovery Community Center. Down in New Hampshire, SOS Recovery. We did FAQs for employees. So the FAQs cover a lot of different things. So what is a recovery? Exactly what is a recovery-friendly workplace? There's FAQs for hiring managers, how to talk about being a recovery-friendly workplace when they are interviewing prospective employees. We have one in there for, we've actually had very good reception on all of our positions on substance use disorder from the public, but we did do a couple of FAQs for our frontline employees so that if they had any pushback from the public or deeper questions, we'll leave it at that, deeper questions around what we're doing with substance use disorder, that they were prepared for that. And then, in a bunch of other subjects, HR subjects, things like that. Another quick thing we did, say this, not that, so stigmatizing language, we've got that distributed throughout the company. And then lastly, obviously, we did an all-employee announcement. So we basically worked down. So kind of started with me and social responsibility managers, brought in board of directors, then brought in the officers, middle-level managers, and then we brought in all of the employees on exactly what we were doing. And then also, I think most companies, EAP resources are really overlooked. We don't talk about them enough. So what this also did for us is we realized we need to go out and emphasize the fact that we do have EAP resources in addition to all the ones that we're calling out that they can call into for help. Happy day. So we submitted our declaration, we got the designation, and we issued our social media and press release announcements. So what's next? I'm a big believer in not just sort of standing still on this or any other issue. So I don't want, so for instance, I showed you some of the flyers or posters that are up around our facility. If those just sit there for 5 years, that's not helping anybody. So we need to keep those sort of resources fresh, we believe. We also have to say, what are the next steps that we can take? So what's the next level we can go with this program? So we have, as it says here, we continue to offer the Doterra. We are looking at making Naloxone available at all of our facilities, so both our branch network and in our operations center. Continuous education, I just mentioned keeping resources fresh and up to date. Shannon showed a lot of different trainings that they have available, engaging, bringing in speakers. We've talked about doing employee resource groups around this as well so that we can create a community within the organization. And then, as I said here, just continuing to provide those additional engagement opportunities. I think that's all I wanted to say, but it really is. For me, it's a no-brainer. It's a really good program. There's a lot of great resources available. You don't have to do it on your own, and we have 330 employees. So the way I look at that is, number one, Shannon or John mentioned the 10% figure, so that's 3. I believe it's probably more. So we probably have, or I know we have, employees in our organization who are battling different issues. I also know, if you just do some quick math, because I'm a banker, so if on average we have 3 members of households in each of our employees' residences, so immediately that's 1,000 people we, the organization, is touching and giving resources to. So it's not just those 330 employees that we're talking to. And then when you extend that out to extended family, friends, that sort of thing, it's pretty cool how many people you can reach and how it kind of increases the importance to you or emphasizes the importance to you of a program like this. So I'm all in, and I encourage you all to be all in. I think we're really fortunate, particularly there's a lot of companies doing a lot of great things in Maine, even without a certification or a recognition or something like that. But I just think the additional resources that a program like this brings are really invaluable, particularly to the companies that maybe aren't as far along and want to advance a little bit further. So I'm very hopeful this comes to Maine at some point. We have some quick questions. I'm trying to watch the stream, so two quick questions for you, Shannon. One of them was, is there a list of recovery-friendly workplaces in New Hampshire that someone can access at this point?
Yeah, so we are continuously updating our website, recoveryfriendlyworkplace.com, with the logos of the businesses that are part of the effort. And so that's like real time. So they're coming on board every day. So that's probably the best place to
Okay.
find those workplaces.
Okay.
Or reaching out to us, and we can certainly provide a list as well.
Great. And then another quick question, sort of a rural urban, I think, question really. Are you seeing a difference in the number of participants from northern New Hampshire versus southern New Hampshire? So the less populated areas versus the more populated areas?
So that is one thing that I'm really proud of, is that we have been able to engage all parts of the state, and there's been interest from all parts of the state. So we have a number of different businesses that are engaged in this effort from the Littleton area, from Coos County, and then we also have a number of businesses engaged in the Nashua area, in other more urban areas, Manchester, and other areas of the state.
Great. And I know we're running out of time, but I have to ask this really quick. Governor's initiative in New Hampshire, Governor Sununu, I don't think is governor for life. So when Governor Sununu, maybe he is, I don't know. But when he moves on, what perpetuates this program in the future? How does the funding keep going? Is the structure in place to keep this program going?
Yeah, the structure is really strong. We have investment from, funders. We have commitment from all different aspects of our communities, including from the business community. They want this initiative. We're going to continue this initiative. It's been great having Governor Sununu sort of spearheading it. It's been fantastic. And I think he'll continue to do so in whatever role he's in, and we will continue to do the work no matter what.
Great. So I'm getting the signal here to wrap up. So great conversation. John and Shannon's contact information was on screen. Mine was not. I welcome questions. You can email me at bpaige, B-P-A-I-G-E, at kennybunksavings.com, or just give me a call at the bank. Pretty easy to reach. Just call the 800 number, and happy to discuss it or put you in contact also with our social responsibility manager. So thanks, Shannon and John. I think this was a great session, and I really look forward to some results from what we're talking about.
Thanks so much.
Great. Thank you.
I started using drugs when I was 19. I thought it was a cool thing to do. It seemed like everyone around me was using, and why not, I guess, really. And I went downhill really fast. Within a couple years, I had lost my kids. I was homeless for a little while. I lost every job I could have ever had. And I got in some legal trouble. I dealt with the criminal justice system for a while. While I was there, I met a lot of girls that were also in recovery, had really cool stories. I felt like I was actually part of something for the first time, which is really weird because that's jail. But I felt like I was free for the first time, I guess, free from the relationship I was in and from the drugs. So I had made all these friends, and I, made some really good relationships, and then instantly was thrown back out onto the street. So I lost my support system. I used within the first 5 hours, I think, and overdosed. The boyfriend I was talking about had left me there. Thank God I came out of it. There were random people around me bringing me back to life. I didn't know what was going on, but it kind of, in the back of my mind, I was ready. So within the next week, I obviously, came out of the overdose and wanted to use, obviously, to deal with what emotions I was dealing with and to get back into my old life, but I needed to stop. I was homeless. I had nothing. I couldn't see my kids. My mom wouldn't even, didn't want anything to do with me at that time. Like, it was the point where everyone was kind of done with me. So I decided to join Groups Recover Together, which is like a group therapy program. Through Groups, my counselor, Tom, recommended a job at the Recovery Center in Holton. So I applied. I had my interview within a week, and it was literally the best interview I've ever had. It was with Eric Lamoureux, who was amazing. And he really just made me feel like a real person, and like I was actually made to do something. So I got the job that same day, which was super exciting. I'm gonna cry. I don't want to cry. So I got the job, and within the first couple months, it was like I had a whole new family. I got my girls back, which was a huge thing. My oldest daughter, you know, kind of comes and goes as she pleases between my mom's and my house, but the relationship she and I have now is amazing. I've been honest with her. She knows my life. She's involved in my life, which is a huge thing for her and me. My youngest daughter's back in my life. She's she's a huge part of my recovery. She's definitely special. You know, having them back has just given me purpose again. I'm a mother again, which is awesome. You know, I love being a mother anyways. Using never took that away from me. But having my girls back is huge. I use myself as an example all the time in this community, just because I know a lot of the people still using or people struggling, and you know, I use my job to reach out to these people and help them get resources and go to the recovery center or have someone to talk to. Now that I don't work at the recovery center, I work really closely with people that are using drugs right now. So it gives me an opportunity to really get into my community and help those people that need it the most, which is super rewarding, especially seeing the people that I used to use with change their lives around. That's the most amazing thing ever. And you know, after running the recovery center for almost a year, I'm finally accepted in my community again. I'm a real person to people again.
Go ahead.
Okay. Hello, I'm Liz Remillard. I'm the Maine Mom Program Manager. I work with the Office of Maine Care Services, and I'm here today to talk about the Maine Mom Initiative, which is an integrated care model for pregnant and postpartum people living with opioid use disorder. And I'm joined by my colleague, Elaine O'Connor.
I am the clinical lead of the Maine Mom Initiative and also the Director of Perinatal Addiction Medicine at Maine Medical Center. And I have worked with pregnant and parenting women for about 15 years, cared for hundreds of women with substance use disorder during pregnancy. Delighted to be here today.
Great. So why are we talking about Maine mothers today? As evidenced by the summit, we're here because many Maine people have been affected by opioid use and opioid-related deaths for many years, and in particular in the last year has been very devastating for our communities. But when we dig a little bit deeper into that data, we can see that we really need to look to and support our Maine moms who have some of the highest rates of opioid-related diagnoses when giving birth, and leading to nearly 7% of our Maine births being substance exposed. So our infants are experiencing in utero and prenatal substance exposure, and then also the effects after birth. And in another sobering statistic is that over the last 4 years, we've seen 25% of our maternal deaths have a relationship with substance use at some point, and in particular at that point of death. So to address this, the Office of Maine Care Services and Maine Department of Health and Human Services applied for and was awarded a 5-year cooperative agreement with the Centers for Medicare and Medicaid Services in 2020. This award funds the planning, design, and implementation of an enhanced care delivery system for pregnant and postpartum people living in our state. And we're hoping to see improved outcomes and reduce costs for this population, in particular our low-income residents that are being served under our Maine Care insurance. Over the last year, we've partnered with 17 sites across the state to begin to build this system of care. And they're testing this integrated model for pregnant and postpartum people with substance use disorders. And in 2022, we do plan to expand our services after learning from our testing sites. MaineCare has placed our Maine Mom Services within our value-based purchasing strategy as a part of our strategy. And that strategy aims to incentivize healthcare teams to focus on quality of care and the value of care rather than the volume of care that they are providing. So Maine Mom is designed based off of our current opioid health home model. Many of you may have heard of this model of care across the state. And the way Maine Mom has used this as our foundation is providing a team-based approach to care for medication for addiction treatment or medication for opioid use disorder, but adding a layer and focus of care coordination with perinatal care at the point of pregnancy, delivery, and postpartum services, with behavioral health care services and social support services. The healthcare providers are incentivized by a per member per month payment for these services, these care coordination services, giving them the flexibility to meet a patient, a person, in their place of recovery at that time. The Maine Mom Services focuses on a team-based care model, adding a perinatal care provider, which can be an OB doctor, a midwife, or even a clinic that can serve the needs of pregnant and postpartum people, in addition to having a medication for opioid use disorder prescriber, and adding other non-traditional healthcare roles like a recovery coach or a patient navigator, people that can share the lived experience of somebody who is pregnant or in their early parenting of an infant and living with substance use disorders. Maine Mom Services has a set of core expectations and services that a healthcare site will provide, including group counseling, recovery coaching services, medication for addiction treatment, screening for and referrals to health-related social needs services like housing or nutrition support, intimate partner violence support, and also having frequent communication with those coordinated services, having a healthcare team that understands and can meet the needs of a patient based on not just her medical needs, but maybe other situations that are happening in her life. And then also adding in supportive conversations about family planning and contraceptive care. This is something that should be happening prenatally and will be happening prenatally with our Maine Mom sites into the postpartum period to support the choices and decisions of a person. So we've heard me say a lot, coordination of care, coordination of care. Maine Mom Services, what we mean by coordination of care, Maine Mom sites and services will focus on assessing and coordinating access to the care, the needs, the health-related needs of a person. So I've already mentioned perinatal services or obstetric health care, but there's other pieces that can affect a person's health care, access to a pediatric provider once their infant is born, safe and affordable housing, nutrition, and not getting the nutrition she might need in a postpartum period or even prenatally. So our Maine Mom healthcare teams are focused more on this holistic, whole person approach, not just focusing on the medical needs of a person. In addition, and at the point of, in addition to the coordination of care prenatally and postpartum, there is the point of delivery and giving birth to an infant. And our Maine Mom sites will partner with all of our birthing hospitals and to coordinate and support education about that interaction and moment of care for our Maine Mom enrollees. All of our birthing hospitals in Maine follow an Eat, Sleep, Console approach, which is a non-pharmacological or non-medication focused approach to caring for infants after birth if they've been substance exposed. And what that means is providing some education to a mom before she goes into labor to support her understanding that there might be an extended hospital stay to monitor her infant symptoms and to help her and her family understand how to care for that infant after they leave the hospital. As well as focusing on the moment of birth, there's the partnership around and discussion around pain management protocols and pain management care needs for a person who's living with opioid use disorder, and really having a coordinated conversation between our Maine Mom sites and the labor and delivery team for a specific patient's needs, especially as they are pregnant.
Great. Thanks so much, Liz. So I'm here to talk to you today about, as the slides go back up, I'm going to talk to you about caring for pregnant women with substance use disorders. I just want to contextualize what this actually looks like on the ground for you all. So when we're caring for women at Maine Medical Center, for example, I'm thinking of a recent case that we've had. We care for women who might live far away. So this particular patient had an hour-and-a-half drive to get to us. A lot of social needs, so housing instability and food instability, and her ability to just come to the practice and connect with me about her substance use disorder, get the medication that she needs, then see the counselor immediately after, and quite literally right next door to where I see patients, and then also connect with a nurse midwife, and to have that obstetrical visit all at the same time reduces a tremendous number of barriers for these women who already have a lot of things going on in their lives. So I'm going to give you a quick primer about caring for these moms. Most of these bullets could themselves be their own lecture, so we're going to go through it pretty fast, but just wanted for folks to be aware of some of the most common issues that we encounter. So I think first off, folks need to know that most substance-exposed pregnancies are unplanned. So if you look at the literature, it's at least 80+% of pregnancies are unplanned. So most often, when I'm encountering women for the first time, they are feeling just really overwhelmed. The pregnancy probably wasn't planned. They're uncertain what to do. They don't know, what do I do with treatment? What do I do with this pregnancy? So most often they're stunned, and I really just try to be present with them as they're working through their emotions that are connected to this. I really want folks to know, don't assume that she's excited, because she may not be, and don't assume that it's not wanted either. So just try to be with her and be present and support her. Really try to listen carefully to what she says about how the father of the baby might react. There's a tremendous amount of intimate partner violence present in this population. If you look at it, it's really, upwards of 90% plus have experienced some type of intimate partner violence. And so it's really important to be talking about that, to be screening for it regularly. One of the most common questions I use is, tell me about the last disagreement you had. That really can help elicit some good information, and I think it's also important to know that depending on their life experiences or adverse childhood experiences, their understanding of even what constitutes violence or abuse may be very different because of their lived experience, so just be aware of that. She may or may not be certain of paternity, so I think it's important to just ask those questions in non-judgmental ways. As I already mentioned, she typically has experienced a lot of adverse childhood experiences, so she may have difficulty developing healthy relationships. Certainly there's a tremendous amount of fear, low self-esteem. There's obviously stigma toward this population, and she may be used to unstable and volatile relationships. So there's a lot going on in her life, particularly when she enters treatment. I'd like to say that pregnancy is a tremendous source of motivation. So when I see women come in, they're like, I'm going to turn my life around. I'm pregnant. I'm going to do better. I'm going to be the type of mom I want to be for this infant. So she's really, really motivated, but she's also really afraid of child welfare intervention. So most folks know that there is a mandated referral to Child Protective Services, and so she's aware of that. And that is certainly concerning to her. My approach generally is to really be super upfront and honest with patients, just explain to them what that means, explain to them that I'm going to be very forthcoming about what my concerns are, so nothing will be a surprise to her. As you're going to hear throughout the day, terminology really does matter. So we want to stay away from words like addict or junkie or even abuse. And it's also really important to remember that infants cannot be born addicted. So I hear that all the time. This infant was born addicted. They are substance-exposed infants. They are not addicted. And when they carry that stigma of the title of addict for the rest of their life, it can be very, very difficult. So it's really important to use the proper terms when you're working with this population and even talking about this population. So screening for substance use disorder is really important. We want every woman to be screened because it affects all walks of life. I want folks to know that verbal screening is the standard of care. So we want to talk to women about the possibility of a substance use disorder, not just get a urine and expect to sort of test that. We want to be able to have a dialogue with mom about what might be going on in her life. It absolutely should be universal and must be done in private. These are two of the evidence-based screening instruments that we recommend, the 4 Ps. is a nice tool because it's really sort of open-ended questions, so it can start a dialogue. We do find that clinicians are not always comfortable having these conversations with patients, so to be able to use an evidence-based instrument to start that conversation can be helpful. And then we use the taste to screen for alcohol abuse typically. We have provided some guidance on the Maine Mom website, which we'll give you at the end, for clinicians who are trying to decide when should I do that urine drug screen when I'm meeting a patient. So this would be useful, hopefully guidance that you can use if it's helpful for you in your practice, and it's on the Maine Mom website, which again is at the end of this PowerPoint presentation. So treating opiate use disorder during pregnancy, I just want folks to remember that medication for addiction treatment is absolutely the standard of care. That could be methadone or buprenorphine. It has changed over time. It used to be that monotherapy buprenorphine or Subutex was the standard. We now recommend using either monotherapy or combination therapy. Both are completely appropriate during pregnancy. It's important to write pregnant and F1120 OUD on the prescriptions, just to remind folks that that's how you get them covered easily at the pharmacy. So that's helpful so that the mom can really pick it up. And monotherapy or combination therapy is covered during pregnancy for Maine Care patients. One of the most common questions I will encounter, with moms is, I want to stop doing everything. Like they'll come in and they'll either be already on Suboxone, from another prescriber, or they'll be using substances off the street and they'll say, I'm just going to stop using everything. And I can completely understand that motivation. I mean, they're feeling like, I don't want to be doing this. I don't want to expose my fetus to this. But we really want to encourage mom to actually stay in treatment, to stay on a medication. The goal really is to stabilize her symptoms. So we don't want her to be craving substances all the time, and we don't want her to be in opiate withdrawal. There are some complications associated with opiate withdrawal, so we really want her to really feel normal when she's in treatment. We also know that moms who are in treatment are much more likely to actually get prenatal care. So that's just it. They come in, they see us, we have contact with them, we can support them, we can get the resources in place that they need, and we can also screen for and monitor for potential complications she might be experiencing. We also know that untreated substance use disorders is associated with a lot of high-risk behaviors. So that might be sexually high-risk behaviors, multiple partners, particularly if they're trying to acquire substances. That can be very difficult for women. They may be having legal interactions and ongoing substance use, so that could be intravenous drug use, and ongoing risk for things like hepatitis C or HIV. So we really want them to be in treatment. As I already mentioned, withdrawal can cause complications to the fetus, so we really want them to, again, feel normal, be stable, and not have any cravings or withdrawal. The other thing to remember is abstinence is really unrealistic. I mean, and I try to work with moms on that, and it's not that they're not trying as hard as they can, and I know that, and I tell them that all the time. It's just not likely that they'll be able to go without using something throughout the pregnancy if they're not on a treatment medication. And really recurrent relapses and withdrawal only make things harder to manage, so we want her to just be stable during that pregnancy. So methadone versus buprenorphine, this is one of the most common questions I get. How do I make that decision? How do I talk to my patients about that? Both are great options. So methadone is actually potentially easier to initiate into treatment because it's a full agonist like most of the opioids we see on the street. So you don't have to enter opiate withdrawal to actually get started on methadone. The challenge with methadone is that it's only dispensed from federally licensed opioid treatment programs, or OTPs. So that can be a big barrier for folks. So for example, a mom that I was talking about, thinking about getting on methadone, the nearest OTP to her was probably an hour and 45 minutes away. And that's typically dispensed daily, so that was just not a realistic option for her. Starting treatment with buprenorphine is a little bit more complicated nowadays, actually, than it ever was probably 10 or 15 years ago. And that's because the strength and the potency of the fentanyl that we see on the street right now is so high, and the effect that it has on really any person using it, not just pregnant women. When you're trying to transition them from the full agonist fentanyl that they're probably using on the street to buprenorphine, which is a partial agonist, when you displace that fentanyl with buprenorphine, it can actually cause a withdrawal syndrome itself. So it can be really complicated to get women onto buprenorphine. There is this thing called microdosing, which again can be a lecture on its own, which I won't cover here today, but that is an option that we're at least thinking about trying to use more. I always tell people that if mom comes in and she says, I'm using quote unquote street buprenorphine, which is in other words acquiring her buprenorphine off the street, it may be perfectly reasonable to start her on whatever dose she's taking. So just have a conversation about that. If she's taking 6, 8, 12 milligrams a day off the street, again, it might be perfectly reasonable to start that. I don't typically require women to go back into withdrawal to get them initiated into treatment. It just doesn't make sense to me. And I want to really have that. I want her to trust me and to feel like she can speak openly to me. So just have a dialogue about what she's doing on the street. So I get another common question I run into a lot is outpatient versus inpatient initiation with buprenorphine. Particularly, as I said, we're seeing much stronger fentanyl on the street. So, what do I do if I precipitate withdrawal in a pregnant woman? That might complicate things, and that's a hard decision to make. You still can do the most of inductions on the outpatient basis. I do consider inpatient induction in a variety of different situations. So if there's certainly an acute medical or surgical illness, if she's got something else going on that's very severe, like a sepsis from maybe an IV drug-related infection. If there's significant social issues, for example, if you're going to send her home with a prescription and she doesn't have a home to go to, that might be another circumstance where I would do an inpatient induction. Typically, if the fetus is quote-unquote viable, which is 22 to 23 weeks gestation, that would be another time that you might consider doing it inpatient, just so that you can actually monitor the fetus separate from the mom. Because if she delivered prematurely because of the opiate withdrawal, you can take care of that infant the best, of course, if it's done inpatient. Significant polysubstance use may be another reason. We're seeing a lot of co-occurring substance use, things like methamphetamine, cocaine. And so if you're worried about withdrawal from multiple different substances, I might do it inpatient. And certainly alcohol withdrawal is also a really important thing to consider. That can be associated with seizures and deaths. So if I'm trying to get someone off both an opioid and alcohol, I'm probably going to do that inpatient, actually, regardless of her gestational age. Important to check the prescription monitoring program. That's, of course, required before you prescribe a controlled substance, and also every 90 days thereafter. Just important to get that into practice and doing it regularly. Important to prescribe naloxone for pregnant women. Another common source of confusion. Well, wait a minute, I don't want to precipitate withdrawal in a pregnant woman. Well, yes, you do, if the risk is that she's going to die of an opioid overdose, because that will, of course, kill her and the fetus. So you absolutely do want to give pregnant women naloxone to reverse an overdose if they're experiencing an overdose. Just another quick point, dose increases are often required during pregnancy for their MAT. I really try to normalize that. It's particularly common in the second trimester when the body is really changing a lot. So mom might start to feel more withdrawal or more craving, and I don't want her to think she's doing something wrong. So I explain to her, look, your body's going to change over the course of the pregnancy. Just be straightforward and upfront with me, and we'll get you on the right medication, the right dose, and just to have that dialogue with her so she doesn't feel like she's doing something wrong. We see a lot of other medical issues for pregnant patients with substance use disorder. So co-occurring mental health diagnoses are extremely common. It's upward 85–90%, probably even higher, really, that have a co-occurring mental health diagnoses. That varies in terms of what it is. Certainly depression and anxiety, very common. Many of the SSRIs or antidepressant medications are safe to use during pregnancy. I will have a conversation with mom, risk versus benefits of starting on the medication. I really encourage people to use medication for mental health diagnoses during pregnancy as needed. I think one of the things that frustrates me the most is when people arbitrarily stop the antidepressant that they're on, if it's one of the safer ones, just because they're feeling like they don't want another medication involved, which I can understand. But at the same time, if mom's depression or anxiety is really poorly managed, she's probably going to return to substance use. And I've seen that more times than I can count. So just keep them on the medication if they're stable, because it will really reduce the risk of return to use. Moms with SUD are at increased risk for postpartum mood disorders. This is very, very common. So we try to see them really frequently and follow them closely postpartum. Another benefit to this program, really, of continuing to deliver that integrated care in the postpartum environment, so they can come in and see the nurse midwife or obstetrician for a postpartum check, have a quick visit with me to talk about the medication and how they're doing, and then work with their counselor, or maybe even peer support, which we're trying to integrate more as well, so that they have a lot of support, a lot of resources in place. I want you to know that the prevalence of hepatitis C in pregnant women with OUD is as high as 50% in some populations. That's about what I see in my clinical practice. It's generally not treated during pregnancy or while breastfeeding, but we are really working to better enhance the linkages to care after to make sure that they do get treatment. When I started practicing 15 years ago, people who were getting treatment for hepatitis C, it was very difficult, it made them very sick, and it wasn't successful very often. It's completely different now. They can get referred, get on medication for a short period of time that they often have no side effects from, and it actually treats the hepatitis C successfully the vast majority of time. So we really try to connect folk with treatment, and because it certainly is contracted through ongoing IV drug use. Infants born to women who have hepatitis C do need to be screened at 18 months of life for hepatitis C. We tend to see about a 5 to 7% vertical transmission. So in terms of the infants that are born to hepatitis C positive mothers, about 5 to 7% will probably have hepatitis C. And again, it's very treatable. I was actually talking to someone last week. You can treat it, into kids 3 years of age. And so it's very treatable even in the young children, and we want to, again, get them connected to treatment if they need it. Method of delivery does not change for pregnant women with hepatitis C. That's a question I get pretty frequently. As Liz already mentioned, pain management can be complicated, and there's often a lot of fear that moms experience. So they worry, what happens if somebody gives me an opioid during delivery? Am I going to feel sick? Am I going to go into withdrawal? Is it going to make me feel high? They use the terms high. And that's, I can totally appreciate why they're scared of this, right? Because they have a substance use disorder. They don't want to go backwards. So really trying to have a conversation with them about that you absolutely can use pain management during labor and delivery. Short-acting opioids like oxycodone can absolutely be used, as well as epidurals are actually a really good option. The state's Clinical Opioid Advisory Committee has put out a position statement on perioperative pain management with patients on buprenorphine that I encourage folks to go to, and that's on Gordon, or the Director of Opioid Response's webpage, and there's some really good information there. The MAT, whether it be methadone or buprenorphine, should be continued through the delivery hospitalization, but it itself does not provide adequate pain relief. That's a common source of confusion for folks. So you do need to add medication on to deal with the pain, but it should be continued. Just be aware that patients with a history of intravenous substance use may be a quote-unquote hard stick. In other words, they have damage to their veins from years of substance use. And just, again, try to have a conversation. Do you have a history of having difficulty getting your blood drawn? A lot of women will avoid actually getting their pregnancy labs because they're afraid that they'll feel shame when they go in. And so, again, let's have a conversation about it. Reiterate that we do need to get some labs. I try to bundle the labs whenever I can, as much as possible, so they get as much drawn at once as they can. And then just have a plan in place. Maybe it's somebody, an emergency room nurse, to come up and do it, or a pediatric nurse, or ultrasound guided or something like that, so you can get blood as you need it to be able to properly screen mom for a variety of things during pregnancy. Breastfeeding is compatible with being on either methadone or buprenorphine. HIV and active drug use are contraindications to that. It is actually compatible with hepatitis C, which is another common source of confusion, as long as there's no blood exposure during the breastfeeding. So if mom's nipples are cracked or bleeding, we wouldn't want to do that, but otherwise it is absolutely compatible. History of trauma also does impact interest in breastfeeding, and again, a conversation to have with mom. How do you feel about breastfeeding? Do you have any concerns? Sometimes women feel more comfortable pumping rather than actually doing breastfeeding sort of with the infant itself, and whatever works for mom is what, and I think that's the message overall. Whatever works for mom, whatever makes mom feel safe and supported is what we want to do. Unique issues for pregnant patients with OUD. So infants born exposed to methadone and buprenorphine during pregnancy are at risk of a withdrawal syndrome. We do monitor them inpatient for probably 5 days, sometimes a little bit longer. As Liz already mentioned, we use the Eat, Sleep, Console to monitor them. Maternal dose does not correlate with a degree of withdrawal. So moms will often say, well, I don't want to, I'm going to reduce my dose. I don't want to increase my dose because I'm afraid that it will make the infant's withdrawal worse. That is not true, so that's important to reassure her of that. And we already talked about Office of Child and Family Services, child welfare notification, and we will develop a plan of safe care, which really is a goal. The goal is to create a safe and healthy environment for the infant to go home to. Decisions around lost or stolen prescriptions must be made carefully because you are treating the fetus too. It's pretty common, I think, in a lot of clinical practice that lost and stolen prescriptions are not replaced. But you need to think of that very carefully when it's a pregnant person because you're treating both the woman and the fetus. Really important to ask whether the partner or other people in the home have a substance use disorder. We want to get them connected with treatment as quickly as possible, again, with the goal of stabilizing the family unit so that the safest environment possible for that baby. Peer support is incredibly important. That's part of the Maine Mom program, and there's tremendous stigma that these women experience. I think all folks with substance use disorders are stigmatized, but no one more so than pregnant women, and the experience they have and the shame and the guilt that they feel is really profound. Counseling is also essential to help build resilience. I mentioned polysubstance use already, and so screen and treat as indicated. Even things like nicotine use disorder, a lot of women with substance use disorders are smoking as well, so just don't forget to treat everything to assess for it. And again, safe to use things like nicotine patches during pregnancy. Contraception is a choice. I always try to reiterate that. We talk to our moms a lot about what's the easiest contraception for you to use. Long-acting reversible contraceptives, so the Implanon or IUD are the standard of care for all women of childbearing age. So I want to be clear, we're not treating these women any differently. That we just recommend contraception for all women of childbearing age, and that's actually the standard of care. The risk of overdose does increase pretty dramatically postpartum. So again, the fragmented care historically, so if you have somebody who's following mom during pregnancy and then they're trying to transition her elsewhere, that's been an issue. One of the many things that Maine Mom addresses, because we're keeping those women there throughout the postpartum period, which is super helpful. I already mentioned worsening mental health disorders, and then child custody issues. Certainly, I think my highest risk moms in the past have been women who've lost custody of their infants and just feel such shame associated with that. Those are super high risk women. So Maine Mom educational support, want to encourage folks to come join us for any of these things if they wish. So we have clinical office hours, which are really great. I enjoy them very much. It's the first Friday of the month at 7:30. And we just talk about clinical cases. Clinicians can come, social workers, peer support, anybody who works with pregnant women. We have a really rich dialogue about how to best care for women. It's a very, I enjoy it very much. There's also the Maine Mom Echo Learning Series, which is the second Tuesday of the month over lunch. And we just have a sort of 15 to 20 minute didactic followed by a case presentation. It's a really great opportunity to learn. So those are two things that folks can participate in if they wish. I'm going to pass it back to Liz.
Great. So Maine Mom officially launched our services just a few weeks ago, July 1st. And we have those 17 sites that I had mentioned or shown on our screen are providing care to women, enrolling women into their services. And ways that you can access those services, we've launched a mainemom.org website where you can learn a little bit more about Maine Mom Services. You can identify a local provider near you using a really neat map function, and can contact the healthcare provider if you're in need of services. This also goes for community support providers that are looking to refer somebody to a service. You can use this as a tool for yourself to helping the people you're trying to serve. Another option to access Maine Mom Services is by calling one of our state referral system lines. It actually leads to our public health nursing referral system and Cradle Me, which is a referral system for all pregnant people in Maine and early parenting people in Maine. And so Maine Mom is now is accessible through that referral system. So you can call that line, you can ask for Maine Mom Services, you'll be connected to somebody who can help you find the services that are near you. And acknowledging, in some of the comments in the feed, acknowledging that right now Maine Mom isn't completely statewide. Calling Cradle Me and the 188 number that you see on this screen can also help direct you to other services that could be in your area. So it's not going to be, it's meant to be comprehensive and supportive of all locations in the state. I also, before we move on to the next slide, I want to mention with another comment that was made in the feed that that the Cradle Me service and referral system for pregnant and postpartum people in Maine has support for opioid-exposed infants that are substance exposed. So for parents who may be adopting an infant or have or other support, it's available to those families as well. So, so this is a really core service to all pregnant families or all parenting families in Maine. So just wanted to make that note to check out Cradle Me as a supportive service. So Elaine had provided a lot of great clinical information that all of our Maine Mom sites are offering as a part of this core service. You can find more information on the Maine Care website. We actually have a list of clinical resources available for clinicians who are supporting pregnant patients or early parenting patients. And then as well, our referral site, mainemom.org, very easy to remember. Keep that in your back pocket if you're talking with somebody who might be experiencing substance use and finding out that they are pregnant or are maybe in that early stage of parenting. There was a couple of other questions that I wanted to address right now. We have just a few minutes to do that. Elaine, I wanted to ask you about polysubstance use. The question came up around polysubstance use being something that really affects all people in Maine, but in particular for women, alcohol use disorder being something that can be concurrent with opioid use disorder. How do you address that in practice when somebody comes in with multiple using multiple substances?
Yeah, so great question. I think we are seeing more and more of that, as time goes on. Really just try to, I think my approach is to try to really encourage mom to just be honest and straightforward about what's going on, and that, we want to help her. We want to get her connected to the right services that will help support her. So it really kind of depends on the substance. If it's alcohol, there are treatments that we might try for that, connecting her with, again, peer support and counseling. And certainly the same would be true for, methamphetamine use disorder, which we're also seeing more of. So I think just the awareness that there is often polysubstance use present, that the best thing that she can do is to talk about it and to, so that we can best treat it, is really, really important. But it's certainly a common issue that we're encountering.
And would you say that our clinical sites that are offering Maine Mom Services, yes, that the Maine Mom is focused on opioid use disorder, but our clinical sites are trained and experienced in treating all substance use disorders?
I mean, definitely that's the goal, that folks are becoming increasingly comfortable. I mean, I don't want to suggest that treating, methamphetamine and stimulant use disorders is really complicated. It's hard for us every day on the ground, and so I don't want to suggest that it's easy for any of us. But I think those are the kinds of things that people often bring, to clinical cases on the echo or to the clinical office hours, where we can really talk about those cases, strategize about the best way to treat them. Understand, sometimes you'll see, for example, stimulants in a urine specimen that the person might not even be aware that they're using, because we're seeing so much stimulant mixed in with opioids and vice versa. So I think really understanding, is there a true stimulant use disorder, or is it sort of passive exposure? What's going on with mom? It can be difficult, but I think, yes, this is absolutely the group of folks to connect to, and if the clinicians within each care delivery partner site have questions, they can certainly reach out to me or others who've done this maybe a little bit longer.
Yeah, I think one last question and I think plug for our learning series that we have as an ongoing support for our Maine Mom sites is, can you talk a little bit about what we have included in those echo sessions around the content? I mean, there's a question around implicit bias or harm reduction. Are those some planned topics that we'll address throughout the next 4 years?
Great points, great questions. I think that absolutely, we only really developed the curriculum for the first year, and so we have certain things that we're planning to cover this year. We talked about sort of the decision around methadone versus buprenorphine. We've talked about co-occurring mental health disorders. We've talked about issues that are unique to pregnant women, like how you manage pregnant women from the OB perspective, that are a little bit different when you have substance use disorders present. We're having a presentation next month about the role of peer support, which I'm really excited for. We have a conversation after that about infectious diseases, and certainly harm reduction will be part of that piece as well. Breastfeeding is another common question as well. So we're happy to have input. I mean, certainly this ECHO will continue on. We only really created the curriculum for the first year. And so we are open to feedback and want to be including all the issues that we're encountering, and certainly all the approaches. Harm reduction is a big piece of it. I think keeping women connected in whatever way that looks like. When I train the residents in clinical practice, the thing I tell them at the first visit is, your most important job today is to make sure that she comes back for visit number 2. And so supporting her wherever she's at, wherever she is, even if you're advancing her just a little toward recovery or starting to have conversations about recovery, that's helpful. But really connecting with her and supporting her so that she feels like you're an ally in her care, and that you want to be present with her. So many of these women have never had anyone in their life that they trust or that supports them. I can't tell you the number of times I've heard someone say, you're the first person who's ever really listened to me. And so it's really hard. And so they don't have necessarily even a lot of people to turn to when they're trying to figure out what to do. So I just do want to say that if there's women out there that are listening today that are pregnant or who know someone who's pregnant who has a substance use disorder, we are absolutely here to help you. We want to take care of you, and the sooner that you can come into treatment. I'm seeing people present later and later in pregnancy, I think because they're just scared. They don't know where to go. They don't know what to do. So the earlier you can present to us, we can help treat you earlier. We get to know you more. We can get the resources in place that you really need. And I view my primary role as really one of advocacy. So I am your advocate going forward. I want to help support you. I want to communicate to Child Protective that you've been engaged in treatment, that you've come to your appointments, that you're doing what's recommended of you, and that you're really trying to do everything you can to have a positive and healthy pregnancy. So reach out to us, go to mainemom.org, and we know that there's still areas that we don't have programs, but we are hoping to grow that over the course of the year. And I do want to reiterate that there's people that are coming to our ECHO series and to our clinical office hours who may not actually be official care delivery partners this year, but they're very much implementing the same standards of care as we're moving forward. So the goal really next year is to have many, many more sites across the state. But find a treatment program, reach out. We are here to help you. And we are here to help you in a non-stigmatizing, not judgmental way. We understand that addiction and substance use disorder is a chronic medical condition. We want to take care of you and get you the right treatment that you need.
Yeah, great. I think that's a great place to end. And I want to say thank you to everybody who attended this session and for all of your really thoughtful questions. There's a session this afternoon that will actually talk through what our Office of Child and Family Services is doing and supporting opioid-exposed and substance-exposed infants. So I would encourage those of you who had some questions related to that partnership to attend that session. Please, if again, just to reiterate what Elaine was saying, if you do know of anyone who can really be supported by Maine Mom Services, or you're not sure, you can always refer them to the mainemom.org site. And if you're a clinician looking for more information, visit the Maine Care website. You can even just Google Maine Mom, and it'll pop right up for you. And we're happy to have an open dialogue with you about opportunities to learn more.
Thank you for coming.
My name is Sarah Langevin. I grew up in Mattawamkeag, Maine, and I had what most of you would call the perfect childhood. I had loving and supporting parents. We went on adventures. We spent lots of family time together. I had everything that I needed and most of what I wanted. I went to school in Lincoln and I participated in school sports. I had lots of friends and I got good grades. I was what you would call pretty prepared for adulthood. I am Sarah and I am an addict. At the end of school, I felt something change. I was dealing with depression and had low self-esteem. And I had this void that I needed to fill, and I tried to fill that with partying and unhealthy relationships. I spiraled from there, using drugs daily, opioids, and trying any new drug that I was given. And I had suffered from many miscarriages. I always thought that if I got pregnant that I could stop, and that would just make me grow up, and that would be it. That would be the day that I would choose enough was enough and I would stop, but that wasn't the case for me at that time. When I got the strength to leave the relationship, I realized how sick I would be without those drugs. And if you've ever been there, it's not a good feeling. And so you do anything that you can to not feel that way. Years later, I was not speaking to my parents who were now getting a divorce. My dad was an alcoholic, an addict, and we were drowning together and spiraling, and without even knowing it, we couldn't help each other and we couldn't help ourselves. And it just got worse and worse. I was tired, lonely, and frustrated. I wanted help. I genuinely wanted to stop, even though I wasn't, but I didn't know how to stop, who to call, when to do it. I met a man and started looking for help, but it was not easily found. My dad then lost his battle with mental illness and addiction, and he took his own life. And while my world was crumbling in front of me, I discovered just a few weeks after his death that I was pregnant. My name is Sarah, and I'm an addict in recovery. I immediately got into MAT therapy, and Suboxone helped save my life. I started the journey on working on myself and the steps to becoming a better person. I am now married to that man that I had met, and I am a mom to 4 beautiful children who are 8, 6, 5, and 1 years old. I love the Lord and my life now. Keeping God close to me was my lifeline, but everybody's avenue to recovery is so different, and there's so many different options that you can take. It's not the same for everyone. In my community, the ones that I thought were the reason I was using or the reason I was stuck became such a huge support system for me, and I came back to them, and I am so incredibly grateful that I did that. So if I can do it, so can you. There's people in your community that care and want to help and see you succeed. So pick up the 1,000-pound telephone and ask for help. It's hard, but you can do it. Now I get to use those struggles, and I get to use my journey as a platform in helping other people. I work for Save a Life Recovery Network as a recovery coach coordinator, and I also run a 12-step meeting at my local church. I've learned so much. I've learned healthy coping mechanisms such as nutrition and physical exercise, all these tools that I get to put in my toolbox now, when before there was just drugs in there, and that's how I dealt with everything. And I'm so grateful for all these healthy people and supports and, coping tools that I get to use now. I've rediscovered myself and who I am now, and it turns out I get to love her. And you can too. If you need help, please reach out. There's people there that care, and we can help you. We need hope because it saves lives.
Good morning again. I hope you're enjoying this morning's conference. I want to take a moment to thank Sarah and all the voices of recovery today. There's 13 individuals that were brave and courageous and are sharing their stories. We began that tradition in 2019, as many of you know, and it's such a powerful part of our summit. I've had the pleasure of presenting personally with Sarah. She's an amazing young woman. So thank you. And thank you to those of you gathered today in Lincoln at the Save a Life Recovery Center, which is our 14th center. I also want to thank, and I intended to do this earlier this morning, we have some philanthropic support today that made it possible to have the summit hosted at our 14 recovery sites, recovery centers, the Maine Health Access Foundation, the Maine Community Foundation, and the Betterment Fund. And this program would not be possible without their generous support. I now have the real pleasure and privilege, as I've had for 2 years now, to introduce the 75th Governor of Maine. Governor Janet Trafton Mills she's the 75th governor, but she's the first woman governor. It took us almost 200 years to get this right. She was also the first woman to serve as Attorney General in the state of Maine, a position she held twice. She was also the first woman to be a district attorney in the state, and now there are several. I think of Megan, Natasha, Mary Ann, and that's just a partial listing. So she has led the way for many, many women in this state. I'm very proud to work for her as the state's first director of opioid response, and that's an indication of how serious she is about this issue. And when she issued Executive Order 2 on the second day that I had worked for the state in February of 2019. We've accomplished a lot since then. We also have a lot left to do, and I'm going to let her talk about that. Governor Mills.
Thank you, Gordon. Thank you so much. Thank all of you for participating in the Opioid Summit. I'm pleased to be here, and I'm so pleased with all the work that Gordon has done in investigating what works, what doesn't work, what we can do better, and we're evolving every day, every week, every year in addressing this epidemic of opioid substance use disorder. 12 years ago, a young man from Skowhegan, Maine, was starting his latest attempt at rehabilitation from drugs and alcohol. One day, he helped another patient in a wheelchair who was struggling to get into the cafeteria. You know, that simple gesture, he told a news station last year, was the first step in breaking free of his substance use disorder. Helping other people helped him break free from addiction. That man later graduated with a bachelor's degree and a master's degree in clinical social work, specializing in substance use disorder treatment. Now, along with his girlfriend, Glenn Simpson now spends his days helping people in recovery express themselves through art. I heard the echo of Glenn's story when I sat down at a kitchen table with restaurateur and person in recovery, Erin French, this week. Many of you who watched our conversation heard about how she, too, found healing in helping others, in serving beautiful food and friendship to a community in need. I'm so proud of Erin and the role model she has become by showing people how to live their dreams even in the darkest of times. During the dark days of this coronavirus pandemic, we've been compelled to stay apart, physically, mentally, emotionally, staying apart to keep each other safe. Still, despite these difficulties, helpers came forth. So many of you listening and watching today, so many of you listened and turned your own concerns into action, outpacing the feeling of helplessness to serve others who are struggling with substance use disorder. You called in to check in on the well-being of your neighbors and friends. You connected for virtual therapy and telehealth sessions, as difficult as that was. You hosted online support meetings, and you opened your doors to offer treatment safely with physical distancing. Two of our leading trainers of recovery coaches, Portland Recovery Community Center and Healthy Acadia, began training recovery coaches online. And thanks to their efforts, more than 200 new recovery coaches have been trained during the pandemic. Our providers stepped up as well, and your actions have been nothing short of heroic. I'm confident that you have saved countless lives. I want to pause here to thank one of those providers lifting up people in recovery, our friend Margot Walsh at Maine Works. Despite the rigors of the pandemic, Margot tripled the size of her business, which provides quality employment to men in recovery transitioning out of incarceration. Thank you for all you've done, Margot, and I'm proud of the ways that Maine people have adapted during the pandemic to provide support for people struggling with substance use disorder. Still, too many people with substance use disorders suddenly found themselves unbearably alone, and without a helping hand, they succumbed to their addiction for the final time. You've heard that this week the U.S. CDC reported that more than 93,000 people died from drug overdose nationwide last year, a staggering record, an increase of nearly 30% over the year before, and reflecting the coronavirus pandemic's toll on efforts to quell the opioid crisis and the continued spread of illegal fentanyl in the narcotics supply. More than 900,000 people have died of drug overdose since the epidemic began recording in 1999. And fentanyl pervades every other illegal substance, with 70% of cocaine overdose deaths and 50% of methamphetamine overdose deaths also involving fentanyl. Here in Maine, as you know, the Attorney General's Office drug report for last year reported 504 people died from opioid overdose, a 33% increase over the previous year, and 300 of those deaths were due to the dangerous drug fentanyl, a 30% of those over the year before. And sadly, those numbers have yet to improve to date this year. The pandemic has been difficult in so many ways. But this increase in drug overdose deaths is another example of how it has hurt our state and our entire nation, and how much more we have to do. My heart breaks for the friends, family, and community members we have lost. People with meaningful lives, all of them. People like Russell Coors, who'd been an integral part of the REST Recovery Center in Lewiston. Russell was a full-time college student and person in long-term recovery when he died at the age of 35. People like Jesse Harvey, founder of Journey House Recovery, who advocated for fellow people in recovery and who died at the ripe age of 28, a very young age for someone with such intelligence and energy. People like Karen Sawyer, a loving mom who lost her son just a year before she died of an overdose at age 44. Our state is diminished by their loss. And there's no simple solution to ending overdose, just as there's no simple solution to ending the opioid epidemic. It was only 2.5 years ago, though it seems like the distant past now, that I took the oath of office of governor and began our efforts to turn back this tide. On my second day in office, I signed Executive Order Number 1 to expand Maine Care, and now more than 77,000 people have access to life-saving health care, including mental health and substance use disorder treatment. I get letters all the time from loved ones of the more than 15,000 people who finally have access to substance use disorder treatment because of Maine Care expansion. One mother wrote to me during the pandemic to say that being able to afford to go to a therapist and a doctor has saved her son's life. Shortly after signing Executive Order Number 1, I appointed Gordon Smith as Maine's very first Director of Opioid Response. And we convened the Prevention and Recovery Cabinet to mobilize state government in addressing the opioid crisis. Shortly after that, I signed Executive Order Number 2, authorizing the state to purchase and distribute thousands of doses of the life-saving drug Naloxone, and to expand Medicaid-assisted treatment, and recruit and train recovery coaches to provide emergency support to those in crisis. Since that time, as you've heard, we started the Maine Maternal Opioid Misuse Program, MOM, to improve our care for pregnant Mainers and new parents who are struggling with opioid use disorder, along with their children. More recently, we established the Accidental Drug Overdose Death Review Panel to review a subset of overdose deaths, to learn from the circumstances surrounding those deaths, and what we can do better, learning to adjust our policies when needed, with the ultimate goal of reducing deaths and reducing substance use disorder. We've created the Options Program to place mobile response teams in every Maine county to engage those communities that have high rates of drug overdoses in order to promote drug prevention and harm reduction strategies, to connect people directly to recovery services and treatment, and to distribute Naloxone, the life-saving overdose reversal medication. We also recently started the very first statewide texting alert system to notify people of a spike in overdoses in their area and connect them with recovery resources. To sign up, you have to text SPIKE, S-P-I-K-E, to 1-855-963-5669 and follow the prompts. As of May 1st of this year, we've purchased 168,767 doses of Naloxone and distributed 89,336 doses of Naloxone through public health and harm reduction organizations, reversing 2,217 reported opioid overdoses. Very basically, saving those lives and giving those individuals hope for recovery. We've recruited and trained more than 530 new recovery coaches. We've increased the availability of medication-assisted treatment for incarcerated individuals in Maine and connected them to community providers upon their release from prison. I know that many of you have watched the breakout sessions this morning featuring Department of Corrections Commissioner Randy Liberty, one of the best commissioners we've ever had in the Department of Corrections, a compassionate, intelligent leader, and Deputy Commissioner Ryan Thornell, who have described for you how we've expanded the department's medication-assisted treatment program. We will work equally hard to ensure the same level of support in every county jail, as we firmly believe we can reunify individuals with their communities, restore their health, and reduce recidivism. The number of recovery residences in Maine has increased from 101 to 120, and 54 of those are certified as meeting the high standards of the National Alliance of Recovery Residences. And we've increased the number of recovery community centers from 9 to 15. We're getting there. And we've distributed through the Maine Department of Education an evidence-based social emotional learning curriculum free of charge to all Maine schools and to parents and to community partners, resulting in over 17,000 modules being used by Maine students. I think that's really important. Prevention, to me, is key. I was pleased to hear Secretary Becerra, my friend Javier Becerra, praise this effort. We have saved lives, but the increase in overdose deaths during the coronavirus pandemic is concrete evidence that we have to do more. We cannot rest until we deliver on our promise to attack this deadly and destructive disease and root it out. Several experts are here with us today to share strategies that have worked in other states, and I look forward to their presentations. While we can and will learn from those experiences, we've also got to develop Maine-based solutions to this insidious problem. So recently, we've updated our opioid response strategic plan with new recommendations to guide our efforts in the coming years. For instance, to prevent the early use of addictive substances by children, young and young adults, we're educating parents and child care providers on prevention practices, and we'll expand partnerships with schools to develop and disseminate effective prevention curricula. To reach youth at risk of developing a substance use disorder, you've heard all about ACEs. We'll increase the number of children's behavioral health counselors. We'll promote healthy outdoor after-school programs and activities. And we'll leverage funds from the private sector and the federal government to sustain successful prevention efforts led by communities across Maine. To reduce the number of both prescribed and illegally obtained opioids, we will use the prescription monitoring program to better identify and educate doctors who may be overprescribing opioids. Many of you who watched my conversation with Erin French this morning also heard her speak very frankly about the problem of overprescribing of both opioids and benzodiazepines by trusted medical providers. It's a problem we've observed for many years now, and we have to hone in on that and address it. We will also strengthen law enforcement's efforts to prosecute drug traffickers who are bringing these substances into our communities. Our Department of Public Safety, along with law enforcement across the state, works every day to intercept and prevent the movement of illicit drugs into Maine. Just in the last few months, in 4 different arrests, the department took more than 4 pounds of fentanyl off the streets of Augusta, Bangor, Portland, Old Orchard Beach, and elsewhere across the state. 4 pounds of fentanyl. To save lives before they're lost to drug overdose, we'll continue to deploy mobile response teams in every Maine county as part of our options programs, and to implement our new MOM program to support pregnant women in recovery. To ensure that treatment for substance use disorder is affordable and accessible, we'll work to expand medication-assisted treatment, particularly in our corrections system, for incarcerated individuals and people on probation, and to educate people with substance use disorder on the availability of different treatment options so they can best find the best program for their needs. And to support lifelong success in recovery, especially for young Mainers, we will increase the number of recovery coaches and expand and broaden the Strengthen Me program, which is a coalition of community organizations and agencies providing free resiliency resources to anyone experiencing hardships caused by the pandemic. We have a long way to go towards healing our state, but there is always hope, and there's the hard work and resilience of Maine people, which has seen us through hard times before. As Erin French noted, quote, "It's the hard times that make you grow and make you a stronger person." Today, we rededicate ourselves to preventing addiction, to persevering through this opioid epidemic, and to achieving our full promise as a people and as a place. Some of the people who best embody the promise of our state are here today. I want to acknowledge and thank the dozens of courageous voices of recovery who've shared their profound personal stories with us. You have sent a powerful message to those who are still struggling. A message that says recovery is not only possible, but probable, and you have to keep trying. Keep at it every day. I certainly want to thank Sarah from Lincoln, the young mother who opened this segment of today's program. Like Erin French, Sarah is a role model for Maine people who are struggling with substance use disorder. Sarah, thank you for your work in saving lives of Maine people. I also want to thank Secretary Becerra and Acting Director LaBelle from the White House for sharing their time with us today, and to Attorney General Fry, Commissioner Lambrou, Dr. Shah, Director Pollard, for all their work and for their strong partnership, especially during the pandemic. They've never let us down. We survived these last 16 months not just by staying apart to stay safe, but by treating each other with compassion and care, by connecting in different ways to those who need it most. That compassion and care is the heart of who we are. It's also the heart of our perseverance through this pandemic. With one crisis waning, we now redouble our efforts to reach every person struggling with substance use disorder, and reach every kid who might be tempted to take up drugs. We say with one voice, your home is here, your help is here. We promise to never lose hope. We're ready to help. And if anyone listening to me right now needs support or knows someone who does, please call 207-221-8198, 7 days a week from 8 a.m. to 8 p.m., 207-221-8198. And you can find resources online at knowyouroptions.me, knowyouroptions.me, including the name and phone number of options liaisons in your county, your community. Speaking of helpers, Fred Rogers, Mr. Rogers, used to say, quote, "When I was a boy and I would see scary things in the news, my mother would say to me, look for the helpers. You will always find people who are helping." One of those individuals I've gotten to know in recent years, who I feel is a strong helper, is Chief Robbie Moulton of the Scarborough Police Department. Earlier this month, Chief Moulton decided to retire after serving the town of Scarborough for 44 years, over 20 of those years as chief. In 2015, Chief Moulton was instrumental in creating Project Hope, which connects Maine people across the state with substance use disorder treatment. Remarkably, this spring, Project Hope served its 500th person. Its success has inspired other police departments across the state. And I got to see that in action one day about 3 or 4 years ago now, to be at the police station for a number of hours and watch as people came in, and the chief and his people addressed their concerns with care and got on the phone and found them immediate help for substance use disorder problem. More recently, Chief Moulton established the Law Enforcement Assisted Diversion, or LEAD program, which allows officers to refer people with struggling with behavioral health challenges or substance use disorder to treatment, rather than arresting them, prosecuting them, or incarcerating them. We hear a lot of talk about police officers in this world these days. We know there are some really good people who wear the badge and who protect our public safety day in and day out. Chief Moulton is one of those who demonstrates compassion and concern for every member of the public, no matter what their challenge is, every day, and we will miss him at the Scarborough Police Department. Commissioner Sawchuk is also here, if he would come forward. And Chief Moulton, are you here in the dark? There you are. And I believe we have a presentation to Chief Moulton to make right now. There he is. And his wife is here as well. She can come forward. There she is. This is the Governor's Award 2021, awarded to Robert A. Moulton in grateful appreciation for his compassionate dedication to offering hope to Mainers with substance use disorder, presented by Governor Janet Mills, July 15, 2021. Chief Moulton, thank you so much for all you've done. Thank you. And for the great example you've set for every member of the law enforcement community and every citizen in the state of Maine. Congratulations. Happy retirement. We'll miss you.
Thank you.
Would you like to say something?
Yeah, just real briefly, I've had an opportunity to work with Chief Moulton for a number of years. He really embodies everything that's good about law enforcement in our state and certainly in our country. And to know that in a 44-year career, he's had such a drastic impact in saving lives, saving the lives of Mainers, is absolutely amazing. And to know he's done 22 years as a police chief in this system, representing his community, is just completely off the charts. And we're just proud of everything that Robbie's done on behalf of our state. I'm just proud to know him as a friend and to see him as a law enforcement leader. Also just want to say thank you to all of our first responders out there across the state. As the governor has mentioned, not only are they out there actively answering calls for service to save lives, but they're actively involved in this conversation to change our systems and to move our country and our state forward. So I thank you for all that you've done. Robbie, more importantly, maybe his lovely wife, Susan, is also here. We appreciate everything that she has done during his career as well. So thank you very much. And Robbie, congratulations, buddy.
Yes.
Thank you.
Thank you very much. To say I'm honored is certainly an understatement, and I'm very proud to be here and accept this. But there's a lot of people. I'm just one of many folks who move this forward, and I'd like to take the opportunity to give thanks to Jamie Higgins and John Gill, who are the original folks who started researching this to see if we could actually make this happen. Tom Hall, our town manager, is here with me today, and I appreciate the support. When I first brought this forward, I wasn't sure how that was going to be received, and Tom's been nothing but supportive along the way. As the governor mentioned back a few years ago, she came down and saw our Operation Hope in action, and she was the Attorney General then, and had some settlement funds that she was able to help us because we do this without taxpayer funds, without we work on grants and donations and things, and so that was very helpful to us. So certainly I appreciate that support, Governor. And Gordon Smith certainly has been a big part of this, and Commissioner Sawchuk, both as a Portland Police Chief and then later as a Public Safety Commissioner, has just been right there every step of the way. My wife Susan, who's propped me up at times and pushed me out the door when maybe I didn't want to. So I certainly appreciate that, and all of the men and women of the Scarborough Police Department and all the police agencies who've really come to view this truly as what it is, a brain disease. And I guess the other thing that I would mention is Dave Packham, a high school friend of mine who has started an organization called SEED, Students Empowered to End Dependency, and has actually produced a 12-part series, Voices of Hope, The Rugged Road to Recovery, that's been running on Saturday nights. And all of those folks have come together. So this award certainly means a lot to me, but it's certainly on behalf of a whole lot of other folks. So thank you very much.
Town Manager Paul, would you like to come forward as well? Sorry, I didn't see you in the dark initially.
Brought a tear to my eye. Now, certainly pleased to be here. It's wonderful to have Chief Moulton recognized for all his service. I've been just so thoroughly impressed with his courage and his foresight and innovation, and been pleased to be kind of behind and just supporting along the way. It's been a wonderful experience, and I think the results speak for themselves. So I'm very, very pleased that we kind of took that risk, and can't wait to see where this grows. So very pleased to be here, and congratulations, Robbie.
Thank you all. Gordon, back to you.
And then thank you for your work. This is a break. You have to have lunch. I don't have to tell you where the bathrooms are. You're all at home. And we'll be starting the Recovery Androscoggin film, I think, in just about 30 minutes. I'll be back with you to briefly introduce that film. And thank you for being with us this morning. Good afternoon. I hope you've enjoyed the day so far. We've got an equally spectacular afternoon for you to match this morning. We're going to start with showing a short documentary film about entitled Recovery Androscoggin. I want to thank our partner, Points North Institute, and the film director, Alex, for the work that they've put into this. I want to thank the people that are in the film. I'll have an opportunity afterwards while we're introducing some of our federal guests to talk more about it. But please enjoy the film. We hope to eventually have a documentary similar to this and similar to the documentary we showed featuring chastity last year in Washington County. We hope to do one of these in every county. So your turn will come. Thank you for being with us, and here's the film.
When somebody comes into treatment with us, we complete what's called an adverse childhood experiences questionnaire. For us, we use it as a gauge to see where somebody's at, and it's really sometimes the first time anybody's ever asked somebody, like, what happened to you when you were a child? I just want to ask you guys a question. How often when you was coming up did you hear that somebody say that they were proud of you? How often did that happen? Was it often, not often? Like, what do you think? So the average of that study was a 4. Not very often? No? And that's like really considered a severe amount of trauma. You got that, somebody enforcing that for you. You know what I mean? Our average in our agency is 6.5. Yeah. Sexual abuse, physical abuse, domestic violence. If I've used drugs to cope with things that happened to me in my life, and you call me a drug addict, you're minimizing everything that's happened to me first. How he was recovering, you know what I mean? Like somebody looked at him and said, I don't look at you as this little kid anymore, you know what I mean? I haven't met somebody that hasn't had some form of trauma before they started using drugs. Destructive coping. What does that look like? I've been incarcerated. I've been in solitary confinement. I've seen what substance use has really done to people. The issue with trauma continues to grow and spread, like it's like generational. It's like we treat trauma, we don't necessarily treat addiction. I have been working in the addiction treatment field all over the state of Maine for about 10 years now. Each guy that comes into our house has a case manager, a counselor, a mental health counselor, a psychiatric nurse practitioner on board, so they already have a team of people. We really try to provide for a whole person.
Yeah, I feel the need to tell everybody I'm wearing a wire. Just because of some of the places we've been before.
Yeah, I was gonna say that. Like that's getting beat up and getting your pockets run around in the old day.
This is maybe my first year or two as a licensed counselor. We never know what it took for somebody to walk through that door.
Questions just to ask you.
So I just want to make sure that I'm aware of that with every new person walking through. Because there's a level of fear there. I know there is. What are some things you want to work on in the next 90 days here?
Learning some coping skills so I don't keep repeating the pattern that keeps leading me to jail. Hopefully find a job that's in housing that's not way up in the middle of nowhere.
Yeah. You may not know this, but everything's in its perfect place right now. Even if it does look out of place, we'll get you there. I wouldn't be here today if people didn't show me love and compassion. So I was looking for every excuse to go back to the old life. I was 26 when I met Jeremy. I was incarcerated for the second time. They put me in room 18, and there was this guy, Jeremy Hilton, there. We almost fought each other in that room. We got pretty close to happening. I tell him nowadays, I'm like, wow, I'm glad that fight didn't happen in that small room. I don't think it would have worked out good for me. But going through that 9 months together, we just developed a bond. I was just being real, and I wasn't trying to make the story cool or anything. He was doing the same for me. I was just really down, and really in my head, I'm thinking about killing myself. I called Jeremy out of desperation, and he said, I love you, man, and I believe in you. And that didn't make me automatically want to stop right then. But I always remembered that. Like, why would this guy believe in me? Like, I'm not worth anything. But it took other people believing in me first to get to that point, because I wasn't going to come to it on my own. The thing I try to do best is look people in the eyes and tell them that I believe in them and that they can do it, because I truly do believe that.
We don't have time to not get real with people. It literally could cost people their lives. We need other people to survive. Trauma tells us the complete opposite, that you don't need anybody, that you're going to be hurt, that people are going to hurt us. So when we designed this program, we designed it to help people grow and be a part of a community. Challenge somebody's belief system, and they start saying, I'm not a bad person. The abuse that I endured was not my fault.
But if we can just focus on this as much as we can in the beginning, we're going to get into a routine, right?
People do a lot of things to obtain substances that they probably wish they hadn't. But that doesn't define them.
Go, little man.
It doesn't have to be the end of the story.
Come on, Natasha! Good stop!
Good afternoon again. I hope you enjoyed the documentary. I want to thank Jeremy Hiltz and his team in Lewiston. They do amazing work, and we appreciate them being generous with our film director. It's my pleasure now to introduce Michael Botticelli, who is then going to introduce Regina LaBelle. It requires a bit of an explanation because, as sometimes occurs, we've had some we've had some changes because all of us that live in Maine understand how this can occur, that Acting Director LaBelle flight was canceled last night, and her flight up this morning, which would have gotten here just barely in time, was held up. So she's been good to send up her remarks in a video that Mr. Botticelli will introduce momentarily. We're very fortunate that that Acting Director LaBelle was able to get back to the city and put that together for us. What we lose by not having her here really is the ability to ask her questions and things of that nature. What we do have here in the studio is Michael Botticelli, who was President Obama's Director of National Drug Control Policy. And many of you will remember that in 2019, when we had our first summit at the Augusta Civic Center, that Michael was the keynote speaker at that time, and he was at that time directing the Graken Center of Addiction in Boston. So since that time, Michael's become a part-time Mainer, living in the central Maine area, and he's retired but has become a terrific mentor to the work to me and the work we're doing in Maine. So Acting Director LaBelle was in fact the chief of staff for Michael when Michael was working at the White House. So again, I wish they could have been here together, but that was not the way it was meant to be today, apparently. I've asked Michael to be fairly expansive in his introduction of Acting Director LaBelle and make some comments about the situation in Maine and the situation across this country. There's no one really better suited to do that than Michael Botticelli, who's well known around the country. So again, I just love having him in Maine. The governor loves having him in Maine. He loves being here. He's had his time in Massachusetts, and now we're just enjoying him here. And so without further ado, my friend, Michael Botticelli.
Good afternoon, everybody. And Gordon, thank you for that introduction. As Gordon talked about, I have the incredible privilege of not just spending weekends anymore here at our place in Maine. Many of you know that I retired in May, so now I get to spend big chunks of time up here. And I'm so privileged, not only because of how beautiful this state is, but because of the leadership, not just on the opioid epidemic, but on a whole host of issues from Governor Mills and her team. But I also want to give a particular shout out to Gordon Smith, who I've really had the pleasure of getting to know over the past few years. I think all of you who know this work and do this work know that one of the joys is the people that we get to meet along the way. And certainly Gordon is no exception in terms of not only his knowledge, but the way that he kind of creates a community of people to do this work. As Gordon talked about, I had hoped to be able to introduce Regina in person and spend some time with her. But unfortunately, as I know all too well, the hazards of traveling can prevent people from doing that. So Regina, if you're watching, I'm only talking so long because we're stretching the time a little bit, but you know well that I can talk. In a minute, you'll hear Regina's kind of comments in terms of the federal response. But I also want to talk about both during my time in Washington, but also as the Director of Addiction Services in Massachusetts for nearly 10 years, to really stress that while federal leadership is important and federal resources is important, it really what is happening at the state and local levels that will make the difference in this epidemic. I have been privileged to watch up close the work that has been happening here in Maine over the past few years. When I was the director in Washington, I traveled here on a number of occasions and saw the work that was happening in Portland, in Bangor, and we just heard from Scarborough in terms of the amount of work that's been happening. And I do really think that Maine has one of the most vibrant and optimistic outlooks that we have as it relates to addiction. You've all heard numerous times today just the breathtaking numbers of people who have died of an opioid overdose, and the work that we have ahead of us. But I remain firmly optimistic, as I hope you do too, that we can make a difference, not just in terms of the opioid epidemic, but on issues of substance use in general. I think, like many of you, I wouldn't be doing this work if there wasn't a sense of optimism that by working together we can kind of change the trajectory of not only the overdose deaths, but just in the pain and suffering that addiction causes generally. And so I really want to thank you all for the work that you have done. This has not been an easy time for anyone, let alone people who are doing addiction work. And I really want to thank you and applaud you for the work that you do on a daily basis to support Mainers in terms of both prevention and treatment and harm reduction and recovery. It's really my kind of pleasure to say that, not just as a public health official, but as a part-time Mainer now. So I'm going to introduce Regina and have an opportunity to say a little bit about her. I'll give some kind of her formal bio, but I also want to talk a little bit more personally about Regina. I had the fortune of having Regina as my chief of staff when I was the director, and all of you who are supervisors and managers know that you are only as good as the team around you. And certainly Regina was the linchpin to any sort of success that we had at ONDCP during the Obama administration. She is a tireless advocate. She is smart. She is compassionate. She knows what she's talking about, but also works collaboratively but with any willing partner to get the work done. So I was, incredibly pleased when the Biden administration named Regina as acting director and as deputy director. It takes a skilled person with a knowledge to walk in on day one and start the work. And that's clearly what Regina and her team have done over the past few months. And I think we've seen, already extraordinary progress in terms of the resources that have been given out and through the president's budget, the commitment to hiring people in recovery and having people in recovery as part of the policymaking process, and her commitment to make sure that we are doing everything in our power. I know Regina continually asks herself, what can we be doing? What should we be doing? What more can we be doing? So I know Regina's disappointed that she can't be here in person to take questions and to spend some additional time in Maine. I know that she will be back and have the opportunity to see all the good work that's happening. So Regina is the Deputy Director of the Office of National Drug Control Policy, currently serving as Acting Director of National Drug Control Policy. And for those of you who don't know, the drug czar, ONDCP, is really tasked with coordinating kind of all of the federal efforts to reduce drug use and its consequences. As you might imagine, federal government is a huge machine, and making sure that everyone at the federal level is working together along the same goals is the task of ONDCP. So she leads a component of the Executive Office of the President, whose mission is to reduce substance use and its consequences by leading and coordinating the National Drug Control Strategy. She was sworn in on the evening of Inauguration Day, and I had the privilege of watching her get sworn in, and is regarded as an expert in drug policy. And she's not just regarded, she is an expert in drug policy. So prior to joining ONDCP, Regina served as the Distinguished Scholar and Program Director of the Addiction and Public Policy Initiative at Georgetown University's Law Center's O'Neill Institute for National and Global Health Law. And while at O'Neill, she worked to focus on the addiction epidemic, public health approaches to drug policy, and using the law to promote access to treatment and support recovery. And Regina also founded and directed, and I think it's one of the first, a Master of Science in Addiction Policy and Practice program at Georgetown University. And if anybody is interested in that, I would encourage you to check it out. As Gordon said, during the Obama administration, she served as the ONDCP Chief of Staff. She will always be my Chief of Staff, despite however high she goes, where she saw the agency's efforts to address the opioid epidemic and other drug policy issues, including the implementation of the National Drug Control Strategy. She also served as legal counsel to Seattle Mayor Greg Nichols, providing legal and policy advice to the mayor on high-profile city initiatives. From 1998 to 2005, Regina was an adjunct professor of policy and ethics at Seattle University's Institute for Public Policy, so she knows cities and the local landscape as well. She received her JD from Georgetown University Law Center and an undergraduate degree from Boston College, so she certainly has deep New England roots. And she is currently an active member of the Washington State Bar. So while she can't be here in person, I turn it over to Regina and her video.
Good morning, and thank you for that introduction. I'm really pleased to be here today. I'm sorry that I'm not there in person. I want to thank Governor Mills and Gordon Smith, the Governor's Director of Opioid Response, for inviting me to this substantive and important summit. It's really a pleasure to be representing the Biden-Harris administration and to do so in New England. I have a long connection to New England and to Maine, and I have relatives actually in the Portland area. So it's great to be with you today to discuss the state of the overdose epidemic and the nation's response. So as we know, yesterday, the latest information from the Centers for Disease Control and Prevention has shown that for 2020, we've lost about 93,000 Americans to opioid overdose deaths. And that's in the 12-month period that ended for the entirety of December 2020. These are all forms of overdose deaths, primarily driven, however, by fentanyl. This is the highest number of overdoses ever recorded. And we expect that in 2021, we will be able to make some progress, but we really need to learn a lot of lessons from what we saw in 2020 and these record rates of overdose deaths. In Maine, we're seeing predicted overdose death numbers higher than any on record. And the same is true in a number of states, from Texas to Minnesota to Hawaii. The data also show us who's dying of overdoses in our country. People between the ages of 35 to 44, closely followed by people aged 25 to 34. What's more, the data also suggests that recent increases in overdose mortality underscore systemic inequities in our nation's response to criminal justice, as well as access to prevention, treatment, harm reduction, and recovery support services. We remain concerned about overdoses involving prescription overdoses, but as I mentioned, the primary driver of today's overdose epidemic is illicitly manufactured fentanyl. And we're also seeing an increasing number of fentanyl-related substances and fentanyl analogs. There are increasing overdose deaths involving psychostimulants like methamphetamine, and there's a concerning increase in polysubstance use. So people are using a variety of substances, including methamphetamine, cocaine, and other opioids. Law enforcement also report a disturbing increase in counterfeit prescription pain medications that are actually pressed pills compressed forms of illicitly manufactured fentanyl. Internationally, our data and intelligence suggests the drug trafficking environment is just as dynamic abroad as our overdose epidemic is at home. And though we've made some progress in stopping the flow of illicitly manufactured fentanyl that's coming directly from China, we know that Mexico has become an increasingly important source and transit country for fentanyl precursors, illicitly manufactured fentanyl, and methamphetamine that's coming into the United States. So as we've taken international and domestic scheduling actions against fentanyl-related substances, we also have to be mindful of new synthetic drugs that pose challenges both domestically and internationally. All of these trends I've cited have, of course, been exacerbated by the COVID-19 pandemic. And so we're facing a very different landscape today than we were even 5 years ago. So it requires a different and urgent response. Now, I imagine that many of you may be thinking that we've spent over a decade now working on this issue diligently to address overdose deaths and addiction. So what else is there to do? And I often ask myself these same questions, and sometimes it does seem like for every forward step we take, we face new barriers and new forms of substances. So we know that we've seen decreases in overdose deaths related to prescription opioids and heroin, but these reductions have certainly been offset by spiking overdose deaths related to illicitly manufactured fentanyl and methamphetamine. But that's really because we can't take a substance-specific approach to the issue. This is about addiction and substance use disorders. And how do we build the type of infrastructure that we need in this country to prevent, treat, reduce harms, and help people recover from substance use disorders? We also, I think it's really important that our approach takes on the same form as substance use disorder. These are chronic conditions, not acute ones. We're not going to solve this problem in a year or even 2 years. These are long-term efforts that take continued response and diligence. So in March, to do this, we also need substantial investments. And in March, President Biden signed the American Rescue Plan into law, which opened up nearly $4 billion in funding to address behavioral and mental health issues. This law also provided, in an unprecedented move, $30 million specifically for harm reduction activities. Harm reduction programs are part of our approach to the overdose epidemic and addiction for the first time. And because we believe strongly that harm reduction programs are important for building trust with people who may have chronic substance use disorders, so that they seek you out and they build engagement and you can provide them with the care and treatment that they need. So in April of this year, we released priorities. There are 7 of them, and they're based on evidence and data. So again, rather than focusing on one specific drug, our priorities are designed to urgently bend the curve on overdose deaths and build the addiction treatment infrastructure our country needs. Our first-year priorities include, of course, evidence-based treatment. That means medications for opioid use disorder, advancing racial equity in our approach to drug policy, enhancing evidence-based harm reduction efforts, supporting prevention to reduce youth substance use, reducing the supply of illicit substances, and then supporting recovery through recovery-ready workplaces, recovery-friendly workplaces, and also recovery support programs, again, in keeping with our approach to the addiction issue, not as an acute one, but as a chronic issue. So community certainly makes a difference in sustaining recovery. And at the White House, we're really focused on building communities of recovery to help people on their worst days so they can have more best days. And supporting people in recovery is really something more than just something we say. We're working to put programs in place that make sure that we have recovery supports And we're also hiring people in recovery. Certainly Michael Botticelli, who is here with you today, was our first director of the Office of National Drug Control Policy, who is in recovery. And we've built on that. We've hired people in recovery. There are people in the president's cabinet who are in recovery. These leaders have lived through many of the issues they're now charged with solving, and their efforts and experience form a key part of the development and implementation of the Biden-Harris administration's drug policy priorities. So the administration's drug policy priorities have also led to several major changes that we're building on the progress of the American Rescue Plan. In April, the Department of Health and Human Services announced two important changes. First, there was a new policy to allow federal grantees to use grant funds to purchase fentanyl test strips for the first time. And also, a barrier to treatment for opioid use disorder, specifically for prescribing buprenorphine, was removed. Thanks to the buprenorphine change, it's easier for physicians to treat people, their patients, with opioid use disorder. And it also allows nurse practitioners and other certified nurse practices to use the best science that's available to treat more people with opioid use disorder. As a result, care for opioid use disorder will now be better integrated into primary care. And in May, President Biden released his first budget request for fiscal year 2023. This calls for spending $41 billion to address drug-related issues to curb this record-breaking epidemic. It includes an unprecedented focus on prevention, treatment, harm reduction, and recovery services. Also in June, our office announced new grant funding from the Comprehensive Addiction and Recovery Act to enhance community coalition work to prevent youth substance use, including for 2 coalitions in Maine. And we'll be announcing more grants through our Drug-Free Communities program throughout the summer and fall. Also in late June, the Drug Enforcement Administration announced a new rule to expand access to treatment for opioid use disorder in underserved communities by using mobile methadone vans. Our goal here is to improve access to this critical medication for opioid use disorder, including in rural areas, and to reach people in need wherever they may live. Additionally, our office's high-intensity drug trafficking area's opioid response strategy is now expanded to all 50 states. So through this, the HIDA program and CDC work together to bring public health and public safety efforts to bear on this issue. We've continued also our close collaboration with the governments of Canada and Mexico to address shared responsibility in our drug problems that we have in this country. And we're working with the government of Colombia to develop new approaches to address their coca cultivation and cocaine production that go beyond just eradication. We're also working with Congress to secure funding to build the addiction treatment programs we need to better build out our infrastructure. So on the public health side, this is an opportunity to ensure that the significant funds that have been invested in states are spent appropriately and invested in practices that will have the greatest impact on improving access to the continuum of care. On the public safety side, the investments we're making are an opportunity to adapt to these constantly evolving challenges, both in terms of synthetic drugs as well as plant-based drugs. Much of our drug supply, of course, originates outside the United States. For example, 90% of the cocaine that's in this country comes from Colombia. And Mexican transnational criminal organizations using precursor chemical ingredients sourced primarily from China produce most of the fentanyl and methamphetamine that comes into this country. Since March of 2020, fentanyl seizures by Customs and Border Protection on the southwest border have increased by nearly 300%. And we're actively working to prevent the drugs from ever coming to the border. This means working closely with our partner countries to address drug production and supporting law enforcement efforts, but also supporting programs that address the root causes that may bring about drug trafficking, and environments of corruption. So while this administration is off to a strong start, we know that we have much more to do. And we've been here for 6 months, but we are moving forward with urgency. And I'm so pleased that Governor Mills and her administration are moving forward with urgency as well. Governor Mills' administration reports that Maine has recruited and trained more than 500 recovery coaches. That's more than double their original goal. The prescribing of buprenorphine for opioid use disorder in Maine has increased by 43%. And under this governor's leadership, the state has helped 22 emergency departments stand up low barrier treatment options for opioid use disorder during the COVID-19 pandemic. And this enabled more than 500 patients to receive their first dose of medication at the hospital. And now people who are incarcerated in Maine correctional facilities are getting the treatment, the evidence-based treatment that they need to achieve recovery and successfully re-enter society. And I intended this morning to visit, I really wanted to see your Maine program in Warren, but I was unable to visit, and I hope to be able to come back to see it because I've heard such great things about the program. So these efforts to expand substance use disorder treatment in correctional settings that include medications for opioid use disorder, which is the standard of care, will help reduce the risk of overdose after reentry and really is a model for other states across the nation. And this builds on Maine's long track record of leadership in responding to this epidemic. Maine was also among the first states to prioritize disposal. I know that we worked on that with folks in Maine some time ago when I was here in the Obama administration. Also, Maine has recently made access to naloxone in the last several years a priority. And in 2020 alone, the state's efforts to distribute naloxone saved more than 1,100 lives. Today, Maine is working to expand its efforts around harm reduction. And I had intended to visit one of your sites today, but the winds of change in Charlotte weather prevented me from doing that. But again, I hope to learn more about your program in the coming months. I want to thank Governor Mills and all of the people in Maine, not just for these accomplishments, but for your leadership and commitment to this issue. We know, again, the numbers yesterday were a stark reminder that in the face of COVID, we continue to have far too many people in this country who are dying from overdoses, and no one ever needs to die from a drug overdose. We know that we can't forget the people behind these numbers. I know that each one of you has a story, and I have my own. I worked in Washington State. I was the Seattle Mayor Greg Nichols' legal counsel, and he called me a couple months ago because his nephew Charlie, who I knew when I was working with him, he was a young boy then, he died at the age of 20, and just a couple months ago. He was a warm, engaging young man. He had recently joined the National Guard, but like so many others, he was taken too soon from his family and friends. The world lost Charlie on January 22nd, and he was 25 years old. And I know that there are many, many stories that each one of you has that are just as important to you as Charlie was to me and to my old boss. So we need to work on preventing these deaths from ever happening. And we have to prevent youth drug use from ever beginning. We know that's part of our charge. Get people with substance use disorder early intervention so that they get the treatment they need at an earlier stage. And if it's a chronic condition, again, continue to engage with them. We have to fight stigma so that we're not judging them about their substance use disorder, which will prevent them from getting the treatment and the harm reduction services that they need. I want to thank everyone for participating today for your efforts. Again, I know that this is not an easy job. President Biden has made it clear that addressing the overdose epidemic and substance use disorder is an urgent priority. This issue, again, is personal to the president and to myself and many of you. And that's why this conversation today is so important. You all are the front line of the issue, and you're actively working to keep communities safe. I know that we can work together to save lives, fight stigma, and work to prevent substance use from ever beginning and prevent people from suffering an overdose death. Thank you very much.
I grew up in Massachusetts, Central Mass, in a really well-to-do town, but for some reason I always felt a little different and a little off. I had trouble with social situations. We did move a fair amount of time, so I was always making new friends. And at the end of middle school, beginning of high school, I started experimenting with alcohol and marijuana, and I just loved the way it made me feel. And that really quickly progressed to drinking at school, taking drugs at school, doing it on the weekends, doing it by myself. I just wanted to be out of myself at any given point in my life. It just made me so much more relaxed. Sophomore year of high school, I started dating somebody that was very into drugs, and he was also very physically abusive, and I didn't know how to handle that. And we started doing opiates, cocaine. He introduced me to injecting drugs. And from there, my addiction really spiraled off. I was lucky enough to graduate high school, and I went to college, but I already had a raging Percocet addiction. Roxy 30s, I was smoking them, injecting them, and I couldn't stay in the dorms. I had to move home. The next 10 years, I struggled in and out. I would go to detoxes and treatments and think I was good, come home, and I couldn't stay sober for more than 2 days. And I was shooting heroin again. My family couldn't trust me. Nobody wanted me around. I couldn't, be trusted alone in a house. I couldn't be alone. My mom would come in my room every morning to check on me to make sure I was still alive. And I hated myself. I would do things I never thought I would do in my life to get drugs, to use drugs, and to support my habit. And heroin took a really, really hard hold on me. From 2014 until 2019, I continued to relapse, moved into multiple sober living houses, multiple treatments, detoxes, and I just couldn't get it. My family was done. Nobody would talk to me. I had to do this on my own. And I was so broken. I wouldn't have places to live. I had no money, couldn't hold a job. But I saw all these amazing people in Portland get sober and stay sober. And that's exactly what I wanted. So it kept me coming back. Women in recovery in Portland were a huge factor in me getting sober again. This last time, the Portland Recovery Community Center always welcomed me, no matter how many times I relapsed, how many times I went back out. They just welcomed me back. There's specific people there that saved my life. And I haven't, thought about using drugs in a long time, and it's been amazing. It's been sincerely amazing. Some amazing things have happened in my life. I completed my first year of college, which I've attempted to go 4 or 5 times and flunked out or gotten high every single time. I have an amazing job where I work with kids with developmental disabilities and autism spectrum disorder. And a lot of people that I work with know that I'm an addict, and they trust me because they know I show up and I can be trustworthy today. I am getting married in 6 days from now, which is so exciting. And I have a man in my life that really appreciates me and sees how much I've changed. My family wants to be in my life. I bought a house, which I couldn't even manage my own bank account. Never mind have $20 in my hand for more than 20 minutes. I today am a Lakes Region Recovery Center recovery coach. I moved up to Casco, so I help volunteer up here at the Lakes Region Recovery Center. I am certified to train and distribute naloxone through Maine access points. And there's just so many different pathways to get sober and to utilize the people in this state. And I'm really grateful for the resources that were in this state that saved my life.
Hi, everyone. Welcome to the Portland Recovery Community Center's breakout session on understanding multiple pathways of recovery and the role medication plays in recovery. My name is Nicole Proctor, and I'll be facilitating today's breakout session. I'm a person in long-term recovery, and I'm also the program director for the Maine Recovery Hub at Portland Recovery Community Center. In Portland, at our center, we serve as the hub to new and existing recovery community centers all over the state, providing technical assistance, trainings for recovery coaching and various curriculums, as well as helping with statewide data collection to show that peer recovery services work in our state. And joining me today in our presentation is Leslie Clark, who is the Executive Director for the Portland Recovery Community Center. And we also have joining us Will Clark, no relation. He is a member of our community at PRCC and will be speaking on his experience later in the presentation. I'm just going to pull up the slides, bear with us for just a second. So again, today's presentation is on understanding multiple pathways and the role that medication plays in recovery. And I am going to turn it over to Leslie to start us off with our presentation.
Thank you so much, Nicole. I'm really happy to be here today. And yes, Will and I are not related in having the same last name, but are related as he is my brother in recovery. And I'm also a person in long-term recovery. And before we get into this, I guess I would just want to talk about how the most important word in the title of this workshop and the recovery community centers is the word community. And why? We're not recovery centers, we're recovery community organizations, recovery community centers, because recovery is all about community. Individuals can only truly heal in the context of family, however that's defined by the individual, community, and society. As long as we are separate or see ourselves as separate and isolated, we can't heal from addiction. And so this presentation is about multiple pathways of recovery, and we're also going to touch on the role of medication. This presentation is about the ways in which we define recovery and introduce some of the ways that people in recovery connect with our peers to heal our mind, body, emotions, and spirit. So the learning goals are to understand what we mean by multiple pathways of recovery, which I think we all hear a lot now, but what does that mean in the context of being delivered or provided or offered in peer-based settings such as recovery community organizations? To learn some about some of the pathways of recovery across a spectrum that ranges from harm reduction to abstinence, prevention, and understand that these pathways may overlap, change, and deepen over time. To learn about the role of medication as adjunct to recovery pathways, support groups, and peer support services as a tool, and to reduce stigma inside and outside of the recovery community in regard to the use of medications. We've heard for a long time about the gold standard for care with people with substance use disorder, in particular opioid use disorder. At PRCC, we see the gold standard of care being a trifecta. It's not just the medication, it's not just the medical treatment, although that's really important, and behavioral health is really important. But also the third part of that triangle is recovery support services. And that's what we're going to focus on today. We know that when people have a whole myriad of offerings that include all three of these parts of care, that they have the best potential for success. we talk about a spectrum and a really broad highway, and we're not going to go through all of these in this workshop today, but to give you an idea, the spectrum and all the kinds of services that fit in and overlap like lanes on a large highway for people who are in recovery, seeking recovery from substance use disorder include everything from prevention and education. Recovery support services is where we're going to focus today. Community-based outpatient, inpatient, recovery residences, recovery treatment, more and more recovery-friendly employment, inpatient treatment, and public health and safety services such as harm reduction, ways that people can stay safe until they're able to recover fully from substance use disorder, or if they choose to remain using drugs to do it safely. Defining recovery, just a little bit about what is recovery. So according to Sampson, recovery is defined as a process of change through which individuals improve their health and wellness, live a self-directed life, and strive to reach their full potential. The Connecticut Community for Addiction Recovery, which is where the recovery coach training that we use here in May comes from, defines recovery as people are in recovery if or when they say they are. Recovery is much more than simply removing drugs or alcohol or use of drugs or alcohol from one's life. It's really about a changed life, about finding wholeness. It involves a re-engagement in life based on hope, resilience, health and wellness. It includes our family, friends, and community. And it takes time. And there are multiple ups and downs along the road. Sometimes, for many of us, it becomes our lifetime of growing and self-actualization. Recovery is very unique to each individual. And it starts when a person begins to make better choices about his or her physical, mental, emotional, and spiritual health. A brief history of the recovery movement in America. I think pretty much everyone has heard of Alcoholics Anonymous and how it started in the 30s and grew out of a temperance movement with a very big influence from William James and humanistic psychology and Carl Jung, and began by two men who found that by talking to one another, it helped them recover from alcoholism. But did it really begin with Alcoholics Anonymous in the 1930s? Actually, Native American healing circles and networks of recovery are traced back to at least the 1750s. So 200 years earlier, there were already healing circles and networks for people for Native Americans to begin healing from the devastation that alcohol had brought into their nations and tribes, and influenced, among many other things, Alcoholics Anonymous. Today's grassroots movement that arose in the 1990s was really a result of the criminalization of substance use, the war on drugs, and the devastation of that increased stigma and prevented people from really being able to find their recovery, and increased discrimination for people. Today, we have a really nationwide, strong and growing grassroots movement. And here in Maine, we have just seen it blossom and grow. In 2007, peer recovery support services were recognized as an evidence-based practice and model for co-occurring disorder, and all recovery community organizations work to break down stigma by doing advocacy, education, sharing our stories, as well as to provide direct peer recovery support. Recovery pathways all have some common ground, no matter what they are. And at the heart of them are some core values and practices. They involve community, sharing our stories, gathering together, sometimes often sitting in a circle, bravery and courage, doing the hard work of change, deepening our understanding of self and others, service to others, and also tools such as medication that we'll talk about, meditation, prayer workbooks, mentors and guides such as sponsors and recovery coaches. Nicole?
Thank you. And so oftentimes you hear about the pathways of recovery. There's really this idea around what is the pathway to recovery. So the pathway to recovery versus the pathway of recovery. A path to recovery often pushes an individual from the pre-contemplation stage of change, where they're not quite sure if they want to embark on a journey of recovery, to the contemplation stage where they're starting to think about it. It's often really catapulted from some sort of a crisis that sparks the need for change in their life. A lot of times that could be something like hospital or ER visits, an overdose, jail or incarceration, and even family interventions. The pathways of recovery really support all stages of the change process. They include mutual supports, meetings, community connection, and peer relationships. And recovery community centers really honor multiple pathways of recovery, expanding accessibility of recovery across cultures and backgrounds. Some of the examples of peer recovery groups that you might find in a recovery community center around the state and in the nation would be all recovery meetings, which really support a safe and non-judgmental environment for all pathways, and all addictions are welcome. Hope groups, which is a non-judgmental, emotional, and spiritual group. There's also Smart Recovery Meetings, which is an abstinence-based organization with a sensible self-help program for people having problems with drinking and using. 12-step anonymous fellowships, which many people are already familiar with. Those range from Narcotics Anonymous to Alcoholics Anonymous, DA for Drug Addicts Anonymous, Cocaine Anonymous, and many, many more, probably too many to name. And Wellbriety, which Leslie spoke a little bit about already, which is a Native American approach to recovery and incorporating the 12 steps with an emphasis on Native spiritual traditions and cultural relevance. There's also Refuge Recovery, a non-theistic, Buddhist-inspired approach to recovery from addictions of all kinds as well. And here's, you just see some of the symbols for the different pathways on the slide that we talked about. Leslie?
So some of the questions that we would propose thinking about is medication a pathway, or is medication a tool? Can you be in recovery if you are taking medication? What does Alcoholics Anonymous have to say about medication? Is it counter to abstinence? AA has an entire pamphlet, and the bottom line of that pamphlet is that AA's position is that it would be wrong to deprive anyone of a medication that they need. And so I think there's lots of confusion within and outside of the recovery community about what it means to be abstinent, what it means to be in recovery. And one of the ways that I think about it, and as we lead into the discussion about medication, is if you think about having a fitness program, and maybe your fitness program is yoga, maybe it's jogging, maybe it's tennis, maybe it is any kind of thing, riding a bicycle, calisthenics. As you are involved in whatever that pathway of fitness is, you may or may not be on a medication. It may or may not be part of your fitness regime. And in America, I think a lot of us feel like if there was just a pill that could cure any number of ills, that is always appealing. But we look at medication as being part of one of the tools in the toolbox, not the answer in itself. Recovery is about a whole life change that's spiritual, physical, emotional, and spiritual, physical, emotional, and what am I forgetting? Mind, body, spirit,
That's all of
and
them.
emotion. I think I got it. Huge life change. So medication is a tool. We don't look at medication as a pathway. We look at it as part of, which is a little bit different than how it can be presented sometimes by SAMHSA or Bill White or some of the leaders in recovery. And we think that sometimes we get caught up in this black and white thinking about medication and pathways of recovery, which is why we're so excited to be talking about this today and sharing some of the wonderful work that we got to be part of at the Portland Recovery Community Center in hearing from people in recovery about the role of medication and how it's been part or not part of their recovery journey. So what do other pathways say? And most importantly, as you listen today, what do you think? Nicole?
Thank you. So as Leslie mentioned, we were able to participate and help organize MAT focus group. So mapping medication assisted treatment, which is often called MAT here in Maine. The focus groups were coordinated by the center in partnership with Pivot Point Consulting for Maine Medical Education Trust and the Maine Opiate Collaborative of Funders. The project started in October of 2018 with the objectives to learn more about what factors actually come into play when considering MAT, learning about what is known and felt about MAT by people in the community, learning more about the role that family, friends, and healthcare systems play in choosing MAT as a treatment option for substance use disorder, to learn more about barriers to treatment and recovery, and then also to learn more about what could have been helpful or what would be helpful when seeking treatment and making decisions about an individual's journey.
We were able to bring 31 participants to 6 facilitated groups. And one group was identified for people who were still in active use or early recovery as they self-identified. We had statewide participation from recovery community centers all over the state. And every person who participated was someone who was currently using or had utilized MAT as part of their recovery journey. The focus group findings, first of all, what really struck us is that participants unanimously said that yes, you can be in recovery and utilize MAT. So this idea that there is a feeling that if you're using medication as part of your recovery, that maybe you're not really in recovery, was definitely smashed by all of the folks that participated. Anecdotally, it felt there was this sense that the stigma comes primarily from a misunderstanding, whether it's within the recovery community or the larger community, between medication as a medical treatment and active drug use, addiction. So people, here's a quote, people on MAT are looked at like we're still drug users. Recovery is more than what you put in your mouth every day. Pervasive stigma occurred most commonly, or was reported as occurring most commonly, by emergency room providers and law enforcement. Other places it was experienced included detox facilities, primary care providers, MAT prescribers, and pharmacists. Pharmacists actually came up several times. So the takeaways of where there is still a lot of work to do and education to provide is that we need to build awareness and understanding among the public, providers, law enforcement, and the recovery community itself of multiple pathways of recovery, to build trust among providers and patients, pharmacists and patients, and within fellowship groups and the other pathways of recovery. streamline the system to make treatment more local, immediate, and affordable, which was really consistent with the feedback that had come from providers as well, to improve the pharmacy communications, to improve prescription refills, to improve referrals to and from recovery supports, access to MAT, connecting drug courts to the first dose induction, implementing and maintaining telehealth, home health, and other ways that improve daily logistics and experience for patients. This came up a lot, especially, of course, for rural areas, how difficult and challenging it can be for people to be able to access their medication, and improve provider practice agreements and make them consistent across practices and regions. Some examples of that were people who felt that if they missed an appointment because of transportation, they lost the exact treatment that they needed as a more punitive kind of response. The most successful outcomes happen when the medical provider understands addiction. We also heard some beautiful stories of when it works, when they work in partnership with the individual and trust. If someone says, I think this is too much, or I think this is too little, or I don't think this works for me, that shared decision-making has good rapport and helps connect the person to medical, behavioral, and the recovery community supports, with an emphasis again on community. So I think at this point, we're going to ask Will if he would share some as a PRCC member about his experience and thoughts about multiple pathways and what this has been like for him.
Hey, how's it going? Yeah, so my experience with the PRCC, I came out of jail. I was put on drug court, and I needed to, and I think I was ready to find, some type of recovery after, 20 years of heroin and meth addiction and cocaine addiction. And I came to the PRCC, and thank God it existed, because, when I got here, I got an extreme amount of support from everybody that worked here and people that didn't even work here, like other members, like building instead of because my old pattern would be, when I get out of jail, is to go back to what was familiar to me, right? And that would be back to the people that were using and back to the same environments and the same places. And this gave me that opportunity for change, for something new. And without that, I would have gone back to my old environments. And so I came here and with an open mind, and I found things like yoga, which ultimately changed my life in a dramatic way. I was a person with severe ADD, a nervous disorder, tremors. My hands shook really bad, and it completely transformed me, to be able to live in the present moment, to connect with my body, to connect on a different level than I've ever been able to could really understand. And then, eventually it led me to a point to become a yoga teacher, you know what I mean? Something I can give to others in recovery. And also here, I got into the 12-step program as well. And, it was here that I found a sponsor, and that was willing to take me through the steps, and I did a lot of deep work there. And eventually, again, I got to a point where, I could take others through the step, just like it did for me, and to help change lives on that level. And yeah, it's been a super blessing. To be able to have to experience so many different things that PRCC had to offer. And yeah, and I 5 years later, here I am. What I found here 5 years ago, I am still doing today. Like, you know, I just came back from teaching a yoga class at Milestone, and with a bunch of new guys in recovery that were just like me. And yeah, so I'm super grateful to have this place.
Thanks, Will. I don't know if you all everybody can hear my dog barking in the background, but I guess she's pretty excited about your story and sharing too. So on these Zoom calls, I was just wondering if you could share a little bit. I know, like for me, the community part and the connections has been over 30 years, has been like such a huge part of my recovery in terms of support. Also having people challenge me sometimes when I need to be challenged. And I just wonder if you would share a little bit about your thoughts about the role of community and connection, and personally, and what you've seen.
Personally, yes. It was like, it was like I kind of mentioned, like, usually I go back to what's familiar with me, but here, I was able to find new friends. I was here to find a sponsor, and yeah, I definitely did get pushed into a direction of, because I was like a person that was super afraid to ask for help. And, some people here, they could read that on me, and they understood it, like maybe because they went through it themselves. So they were able to be like, hey, you should get a sponsor. And I was like, yeah, I just don't really dare to ask anyone. I don't dare to ask for help. It's been a big problem my whole life. And I didn't really have to, like someone, like, they're like, well, let me help you. And that's kind of how that went down, in order to meet new people, and to like find someone that I could connect with on that level, that could help bring me through the steps at that time. Yeah, the community, like I have, the people that I met here 5 years ago, a lot of them I still stay connected with today. Yeah, it's this place basically, saved my life with being able to connect and being able to like grow this new set of friends in these and yeah.
Thank you. I have a couple of questions for you. I know that when I first walked into PRCC for the first time in my own early recovery, the stigma and the shame that I felt about my own disease of addiction, right? And the feeling that when I came into the center, I wasn't judged and I had so many options available. And I wonder if you can, with the expansion of centers that is happening here in Maine, speak to the importance of that feeling that you get when you walk into the center, opposed to, just the general community, how the community within a center is so loving and compassionate and welcoming. If you could just speak more on that. I'm just curious.
I mean, during that time in my life, I always had a fear of walking into somewhere new, right? Something I didn't know, and especially something completely different than what I was used to. And I think I was just kind of, at a point in my time where I was ready to like face some fears, and I felt, for me, it was, I came to the community center, and it was pretty easy for me to walk in the door because I heard so much about it because the word was put out there. And like for me, like I had a hard time walking into a yoga class. I was like one of my biggest demons that I faced. with the, oh, you're a male guy that's done a lot of prison time, like you can't go to yoga. But I know yoga did a lot of special things for a lot of people and helped a lot of people through their own trauma. And, and just kind of being here, I wouldn't have walked into a regular studio, but because it was offered here and it was free, and that was like another great part about it, where I wouldn't have been able to afford to go to another yoga studio at, $15 a class. I didn't have the money for that. And just to see other people like me walking into class, just kind of made it so much easier for me to be able to do that.
When did you find yoga in your recovery? Was it really early on, or was it later?
It was right at the beginning. It was like maybe within the first 2 weeks of being out in recovery. I had an experience with it in jail one time, kind of a small one, where someone came to like a maximum security I was in and taught a yoga class, and I used it as an excuse to get out of my cell at the time. But I remember the way I felt afterwards, and I knew I needed to pursue it. And then, when I found it, I needed to pursue it on a whole different level of like the spirituality aspects as well, because there's a lot to yoga. It's kind of like the 12 steps. They use a lot of the 12. Actually, the 12 steps took a lot of the yoga traditions to use for themselves, and it's more than just a physical practice. There's a lot of different roots of yoga that really benefited my life in a lot of ways, and then ultimately to be able to give it back has been the biggest blessing of it all.
Your story really speaks to what Leslie was talking about earlier in the presentation about the trifecta, right? Like the mind, body, and the spirit, like treating the mental, the medical, and treating the whole body as part of our recovery. I'm curious too, if you could speak more on how incarceration affected your recovery. You mentioned that it was a big part of your story.
Yeah. Incarceration, what that looked like for me is it would keep me abstinence from drugs and alcohol, mostly drugs, for a while I was in there. But I never received treatment in there. I was kind of put in my cell until I got out, and so when I would get out, I would go, right back to what was familiar, to me. You know what I mean? Like I didn't have any direction walking out of incarceration. So I would usually go from incarceration to using, within a week. Sometimes I'd try to fight it and white knuckle it. I never got a chance to receive any treatment while I was incarcerated throughout the times that I was. And incarceration never helped me become a person for recovery. You know what I mean? It never helped change. Sometimes it would make me worse.
You just said something that made me think about how for a long time, I didn't understand the difference between what was comfortable and what was familiar. I thought the things I was doing were to make me comfortable, but it was really just that they were familiar. And you just said that so well, like falling into what's familiar. And then just to be able to come into space with other people who understand what it's like. And it may feel a little uncomfortable at first, but it feels familiar in a new way, in a good way. So yeah, that was cool. I wondered before we kind of move to the next piece, if there was anything you wanted to share or thoughts you had about stigma and stigma related to MAT or any of that piece of it, and how we can reduce stigma, how you think we can help reduce stigma within and outside of the recovery community itself.
Yeah, with MAT, I, personally am not on MAT right now, but I have experienced it since it first came out, I think in 2004, when it was like first introduced into America. And what I know, is only my personal experiences is, at times, MAT kind of saved me, like it saved my life in a way, because it would I would be able to get for me, I was like never really ready for recovery. When I was on MAT, I never tried to do anything different. I would kind of just take the medication and not be willing to change any other way. So eventually I'd go back to using because of that, I feel like. But in those times I was on MAT, it would give me opportunities to build my life. And I wasn't the same person. When I was using, I was a different person. Like when I was on MAT, it was like I was completely sober. But I was able to do all the things and get a job, and I could work, and I could live like a normal functioning life while I was on MAT, and which I couldn't do while I was using, right? And it gave you, it kind of cleared, I was able to have a more clear mind and get more direction. And I think, the only thing that stopped me from change was, my unwillingness to find a recovery network or some type of, to learning to heal from my past traumas. I needed more. I was a person that needed more than just MAT. I needed a lot more. I just didn't know it at the time. I kind of, considered it the magic thing to give me a break and a pause, which was great. And, it maybe could have saved me in other ways of overdose. And, I was less likely to overdose while I was on MAT. My chances, it really drastically slimmed my chances of overdose and dying. So yeah, that's kind of and the key for me personally is how I take MAT today, even though that I'm not on it, is to stay what recovery did for me, stay open-minded and embrace what they have at that moment, you know what I mean? And to go from using to MAT is a pretty hard step, and it's a huge challenge as well. And I don't think that people on MAT get that type of credit enough, and I think we got to look at that and kind of open that up, that it's not easy to even get, and that's, I feel like part of the stigma too, right? It's like, wait a minute, they jumped from this lifestyle and went to this lifestyle, and now they're here, they're growing, and we all grow at different paces. And as long as we're growing, we're not dying. And I feel like, that's the key, and society needs to embrace that on a whole different level than we may have in the past.
That's really beautifully said. Thank you so much, Will. And I think it goes back to, that there's all these different tools and all these different paths, and we can try different ones at different times. We can try them simultaneously. We can listen to others. And at the end of the day, it's a very unique, every individual, we learn to trust innately what is the right path for us. And, with all this support and around us and opportunities. And I was thinking even, MAT, one of the things that struck us in those focus groups was how many different types of medications people have found help with, or even things that we don't think of always as MAT, more knowledge about the range of medications that are one of the tools, or that are some of the tools in the toolbox, so that people can have the best path and most comprehensive set of supports around that works. And I know for me, like you, over the years, that's been different things at different times. And thank goodness there's so many options. So thank you, really appreciate it. Nicole, I think Gordon Smith had asked Nicole to save a little bit of time and share some about what's happening with the hub and around the state, and some of the work that's been accomplished and growth that has happened. So in these last few minutes, Nicole, could you share some of these highlights, please?
Yeah, absolutely. I'd be happy to. And thank you, Will. That was a beautiful story. And thank you for your honest sharing and willingness to do so. So yes, so the Recovery Hub here at PRCC, we became the Recovery Hub in 2018. And at that time, just real quickly, at that time, there was only 2 recovery community centers or organizations in the whole state of Maine. And that was Barn and Brewer and PRCC in Portland. And in the last 3 years, that network has really grown and is continuing to grow. So you can see here a list of, I think there's 13 on this list, and it's now grown to 15 in the last 2 months, with more activity in communities around the state, especially now where, coming out of the last legislative session, LD 488 was passed to expand recovery community centers in our state. So this real quick is just a brief overview of what happened in a crazy year of 2020 during a global pandemic, and how much happened at these centers around the state. So as you can see, even with the pandemic, there was over almost 7,000 activities offered. Most of them were happening virtually because of COVID, but it was at least 55,000 attendees at those different activities. That's a lot. We also provide the peer recovery support for recovery coaching, but also telephone recovery support happens at centers where we can just connect by phone on a daily, weekly, monthly basis, however often somebody wants to receive a call from their recovery community center. And we've made over 18,000 calls last year combined in the state. And then the recovery coaching programs that are happening all over the state at centers, we've had over 2,400 recovery coaching sessions during, an unprecedented year where nobody could really connect in person. So it's really amazing that so much work was still able to happen, and so much community and connection was able to happen. And it really gives you a sense of why expanding these services in communities around our state is so important. So I already actually covered pretty much everything on this slide, which is good because I think we're about running out of time. So real quick, just an update on recovery coaching and the new registered and certified status for coaches in our state. So our state has developed the Maine Peer Recovery Coach Certification Board, and the board has developed a 2-tiered system, which currently, starting in March of this year, 2021, the first tier of our credential was launched. We now have 78 registered peer recovery coaches in our state as of June 30th. And just so that everybody, if anybody watching has taken the CPAR Recovery Coach Academy course and the ethical considerations for recovery coaching course, and would like to go ahead and get your application in to become registered so that you can later this year, when certification rolls out, apply for full certification. You can go on to our website, where you can download the application. It will lay out all of the criteria for education, the code of ethics for becoming a registered recovery coach, and you will have to provide the certificate for your classes that you've taken. And next slide. So real quick, I've already covered everything on this and we are running out of time. So I'm just gonna say, go ahead, there you go. So please follow up on our PowerPoint presentation, which will be sent out. It has all of these useful links to recovery resources, to our website where you can find the application for registered peer recovery coaching, and many other resources. And I just wanted to thank everybody so much for taking the time to spend this breakout session with us. Thank Leslie for a great presentation and for Will for coming on and sharing his story.
Goy, my name is Steve Knockwood, tribal member of the Rustic Band of Micmac. I'm also a tribal member of the First Nation people of Canada. But most importantly today, I'm a Native American in recovery. What that means is I walk the red road. You know, my story is I started opiate use in my early 20s, stemming from a back injury. You know, that led to substance use disorder, which went untreated for 20 years of my life. Everything that I'm getting ready to say stems from, you know, a single conversation I had with somebody I considered a spiritual elder early in my recovery. You know, he told me that the most precious thing that I had to give, you know, was my truth, my testimony. And that someday, you know, I was destined to give that testimony in an attempt to help others, you know, and I found the strength and courage to do that, you know, I'd gain a place as one of the trees in a great forest of healing. You know, early 2017, being faced with long-term incarceration, you know, I first decided to seek treatment for substance use disorder. You know, that brought me to the farm in Limestone, Maine. I graduated the 28-day program. That's where I was introduced to Native recovery. Making the decision to, you know, live inside a spiritual principle, I was faced with the wreckage of my past. I ended up doing 3.5 years in prison for my past. You know, that turned out to be one of the greatest gifts, you know, that I could have received at that time. It was time that I spent to learn about Native ceremony, spiritual ritual. You know, I was able to learn extensively about my culture, about the disease of substance use disorder. And it's where I found the passion of being of service. You know, we are moving forward to bring that pathway of recovery to Maine, to the tribal people that want it. And it's amazing. It's more than I could ever have asked for, more than I could ever deserve, but starting to accept it's what I was meant to be. We deserve the chance to get better. We deserve the access to support, to many pathways of recovery. You know, we need to be strong in willing to stand up to enact policy change to where there's decriminalization of mental illness, of substance use disorder, that these people are diverted from prison and they get the support and services that they need to recover. And that when we're given those chances, we become productive, respected, and take a rightful place within the communities. You know, that we become what we're intended to be. And it's a lot more than just an addict. You know?
Thank you for joining us for our presentation of a Wabanaki Vision of Recovery, the journey to building culturally supportive substance use disorder treatment and a continuum of care. My name is Erica Farnloff, and I am the Division Manager for Recovery Housing and Supports at Wabanaki Public Health and Wellness. I'm very excited to be able to welcome our panel today. We have Chief Clarissa Sabatis of the Holton Band of Maliseet Indians, Chief Kirk Francis from the Penobscot Nation, and Lisa Sakabason, Director, Wabanaki Public Health. Today, we are going to be sharing the story and the journey of the Wabanaki Center for Healing and Recovery. And I would like to introduce our first speaker, Chief Clarissa Sabatis. Chief Sabatis is the chief of the Maliseet Indians. She is from Holton, Maine, and a registered nurse. Prior to her current elected position, she spent many years helping to lead a team to establish the public health infrastructure for the Wabanaki tribes of Maine. Chief Sabatis is passionate about the health and well-being of her people and focuses on improving conditions that impact the overall health and wellness of the Maliseet Nation. Chief Sabatis is committed to the Maliseet language and cultural efforts, spending much of her time promoting culture, language, and healing She is a leader in the current efforts to improve state-tribal relations and to recognize tribal sovereignty. Thank you for joining us, Chief Sabatis. We are excited to hear your words.
Greetings. First, I'd like to say thank you for the opportunity to join you today and talk a little bit about the Wabanaki tribes and the Holton Band of Maliseet Indians. This opioid epidemic knows no boundaries, and that's true for us in Wabanaki territory as well. Prior to my tenure as chief, I worked in public health and spent many days and hours convening tribal leadership and tribal citizens and partners, including the federal government, to talk about how we can address this disease and how we can, heal our people, I guess. As chief, my decisions that I make now impact, my small community and my small tribe. However, we also have to live with the impacts of decisions made external to us, and those can be good and bad. While there's been some wonderful work taking place within our communities and at the state level and federal level with regards to prescription drug misuse and illicit drug use, I think the piece that's missing or has been missing is how do we replace those things and give our people healthy alternatives? How do we treat them with no resources? We live in an area where it's extremely difficult to access detox. We live in an area where, we end up having to send our people to North Carolina or New York to get residential treatment. And, so there's a lot lacking and a lot of needs that are unmet. And as small communities, while I would love to be able to say that we can meet every single need for our people, we just don't have the capacity, and we rely on outside resources to help meet those needs. And when we don't have the available resources, it makes it hard to come up with solutions to help our people be healthier. I feel so fortunate to be here today with you and share that because of the hard work of Wabanaki Public Health and Wellness, tribal leaders, and our partners, that all of our dreams and our visions are coming to fruition. And with the creation of the Center for Wabanaki Healing and Recovery, that we're really going to be able to provide services to our people in a way that really envelops them as an individual, and not just treating their physical needs, but also their spiritual and cultural needs as Wabanaki people. I'm sure Lisa will go into more detail, but I wanted to talk about some of the conversations that took place throughout this process and just highlight a few things that people said were really important. And I think that, this was pretty consistent across the board. I guess to start, the consensus was that we didn't want any place where anyone was healing to feel like an institution. We wanted them to feel at home. We wanted them to have the familiar smells of home, whether it was our grandmother's cooking or, our sacred medicines burning. We wanted to have familiar sounds. We want to make sure that our Wabanaki drums and music and songs are playing, and we want to see familiar things from home. Artwork from our people, whether it's baskets or drums or clothing. Those were a lot of the things that were important. And access to our sacred medicines, access to our sacred spaces, and in an intentional way. So not having sacred fires as something off to the side, but really integrating our cultural beliefs and our healing practices into this Western medicine that is happening. So we're not just addressing the physical needs of our people, but their needs as a whole individual and as a Wabanaki individual. So, you know, what we do know is that our culture is a protective factor, or feeling a sense of belonging. And we really wanted to have that be front and center through everything that we do. This work that's taking place is the foundation for our communities to continue to heal. It's my hope that my community and my tribe, and even beyond our borders, will see a day when we live free from addiction. So I will leave you with that, and thank you again for the opportunity to join you today. Maliwan.
Thank you, Chief Sabatis, for your words, your vision, and your support on this ongoing journey. Our next speaker is Chief Kirk Francis of the Penobscot Indian Nation. Chief Francis has served as chief since 2006 and holds the distinction of being the longest-serving chief of the Penobscot Nation. He currently serves as the president of the United Southern and Eastern Tribes and formerly served as the treasurer for USET as well. In addition to serving in leadership to his tribal nation, he also chairs the Natural Resource Committee of the National Congress of American Indians. Chief Francis has deep cultural ties to the people, the land, and the river. He is an avid outdoorsman, practicing the traditions of hunting and fishing, for which his family is well known. Thank you, Chief Francis.
My name is Kirk Francis, and I'm the current chief at Penobscot Indian Nation, and it's great to be talking today about the opioid crisis that's facing not only this entire nation, but obviously in a disparaging kind of way in our tribal communities as well. Just early on in my time, I've been the chief now for 15 years. This has been an issue that's been with me from the beginning. In 2005, 2006, we were really battling addiction through prescription drug abuse. That was really the crux of our issue. And what we realized very early on was that obviously this is a multifaceted issue that requires a very comprehensive approach in terms of treatment. There are many drive-in factors. There are so many triggers in terms of where people are economically, where people are with their housing insecurity, food insecurities, a whole host of things that really drive a person's addiction. It's not simply about getting people to stop doing them. There's a whole list of other factors around that. And the other thing we really realized early on, from 2006 through about 2012 or 13, was that nobody was really coming to save us on this issue. In the Northeast, there was a huge prescription drug problem. In out west and in other places, tribes were really starting to deal with the methamphetamine problem at that point. And all of the federal resources, everything from jails to methamphetamine based programs were being funded. And despite our efforts every year during the appropriations process to really get focus on what was happening in terms of prescription drug abuse, kind of fell on deaf ears during that period of time. And then, of course, this issue caught up to everyone across the country. And then, of course, methamphetamines caught up to us here a little bit. So we were very active in this area early on. And then what we start to see later on is really the switch from a pill that may cost somebody $100 on the street to a much more cost-effective way for the addicts to abuse these drugs through the kind of prevalence of heroin at that point, and then of course a whole host of fentanyl and a whole host of other things that start to come into play over those years. So our community starts to get more and more kind of devastated by the effects of this addiction, because it's more readily available, and it's cheaper, and it's also much more dangerous, as we know, and we start to lose people. And with the creation of Narcan, of course, those losses could have been a lot more in our communities, but we're able to mitigate some of those losses with the administration of Narcan within the community. So all through that period of time, some of the lessons learned were that despite our best efforts through wellness courts, through our great programs, through all of those things, we needed a wraparound approach. And a huge part of that wraparound approach is being able to get people into treatment. And tribal people are different than other demographics of people in the sense that, getting people, one, to admit they have a problem, and two, to want to go to treatment. But there are a lot of things that are kind of inhibitors in that process, in terms of leaving the reservation, going to a place where there might not be any cultural programs, there might not be any tribal understanding, all of those things. And I personally had people at my desk one day seeking treatment and not be able to find them 6 or 7 days later, because we're going through some bureaucratic process that in other facilities that I guess fairly are also stressed with numbers and how many people they can take in and all of those things. And you lose people in that period of time. It's important to get those folks into treatment in that moment and be able to get them the help they need, because any excuse to go back to the drug use, and it doesn't take long, you've kind of lost them. So what we started to really think about, and quite frankly, it's a daunting task to try to figure out how do we get our own treatment-based facility here in Maine that focuses on Native people, that allows them to be talked to in a way that they understand culturally, all of those things. And of course, we stumbled around that issue for a very long time. And of course, the partnership with Wabanaki Public Health and Wellness and others to bring this conversation to a new level was really invigorating, I think, in the process of really being able to realistically think for the first time that we could get these things accomplished. So we knew the missing piece was getting people to treatment where they could be cared for, where they could also be understood, and also ultimately have successes with that. So this kind of dream we've had of a treatment facility is now becoming a reality. When we talk to all the other tribal leaders and the meetings we've held now for years to try to flush this out, it just, the more and more we met, the more and more we continue to talk, the more and more that people like Lisa and folks at Wabanaki Public Health and others were really starting to show us that there's a reality that can happen here. And now it's, of course, a very exciting time in terms of where we are in this process, to have facilities that we know are dedicated. You can see them. It's very tangible. And you also understand what the program's going to look like, how people are going to be treated, where they're going to be treated, what's available for them. And then a targeted date of an opening that is in the very near future that is just super exciting. So we've kind of come full circle on this issue, from really kind of spinning our wheels for a long time to try to figure out the comprehensive kind of wraparound approach to deal with people, understanding where those gaps were, and then being able to say, we need partnerships and we need we need people that are going to share that vision and focus on this issue. And that's happened. And I, for one, am really appreciative of it. I am touched by this disease like everyone else in tribal communities. I have family members that continue to struggle with it today. I've lost family members. And so it's not unlike a story that most tribal people can tell you. And so I just think it's extremely personal for me, because it's been, quite frankly, a feeling of failure around this issue for a long time. And so whether we're talking about helping people through educational outcomes, economic success, housing security, and just overall sense of worth, that's the real challenge, and really what we're trying to do and accomplish, because we want people to feel uplifted. We want people to feel like they're part of the productive process in the community. And quite frankly, when people are lost in this addiction, it's really difficult to make them feel that way, especially when so many people around them are hurting because of their behavior and other things. So I think it's not only a great way to get people treated, it's a great way to give people their lives back in terms of getting them reintegrated in the community. So on behalf of our tribe, we're just super excited about this thing coming to fruition, and being able to see it myself last month and really walk through those properties. You can really see the vision there and how people are going to benefit.
Thank you so much, Chief Francis, for your words and your emotion and everything. So thank you so much. I'd like to introduce our next speaker. It's Ms. Lisa Sockerbasin from Wabanaki Public Health and Wellness. She is our director. As a Passamaquoddy citizen, Lisa has an extensive experience and expertise in tribal and state government, nonprofit management, and philanthropy. Prior to Wabanaki Public Health as an organization's director, Lisa served as the director of the Office of Health Equity, Maine Department of Health and Human Services for 10 years. And before being named the director, Lisa worked as an epidemiologist in the infectious disease program for the state of Maine. Early in her career, Lisa worked as a nurse epidemiologist with the North American Indian Center of Boston, focusing on health disparities and inequities facing the Native American communities in Massachusetts. And with that, I will turn over the presentation to Lisa. Thank you so much.
Thank you, Erica, and thank you, Chief Francis, as well as Chief Sabatis. I'm going to start sharing my screen. I have a presentation. Chief Francis was able to share how great it was to see the vision of the work. And I would love to share with all of you that same vision. So what we wanted to make sure from the very beginning with our work, and I think you've heard it in hearing from tribal leadership, is that wherever you are in your journey, we want to have a place for you. We wanted to be sure that whatever we created for recovery services for our people, that there was a place regardless of where you were on that journey, whether you were in active addiction, you are currently using substances, or perhaps you are just being released from being incarcerated and haven't used substances for a while, but need a program. We have a place for you. If you needed medication-assisted treatment, we have a place for you. If you needed assistance with a job after leaving a recovery home, we wanted to be able to serve you there as well. We wanted to serve you if you were in crisis, and we wanted to serve you when you were well. So the areas that we knew we needed to focus on was first food, and making sure that we are able to serve our folks, that they're able to be nourished both spiritually and physically. Obviously, recovery services, which we will be talking about. Crisis services. One of the things we knew we needed was to be able to know when people were in crisis in the moment, And as Chief Francis stated, that there was a place for them to go after we were able to address the crisis in the moment. We also knew from the very beginning that our communities needed to be ready to welcome people back when they were ready to go back, and that there needed to be services in our communities as well. Peer services is something that we have really focused on growing and supporting. We believe that peers and people that have similar journeys of substance use disorder are sometimes the strongest advocates and supports for those folks that are currently in a different place in their journey. And then, of course, community response. How are we responding in our communities and setting our communities up for success in this work? So these are our places. These are the places that we took our tribal leaders to visit. We have a gathering place. We have a place of culture, healing, and ceremonial connections. We also have a family and friends connection center, a healing lodge where many of the services will be provided, your traditional services of case management, group therapy, and also in, partial hospitalization services. That will happen at the Healing Lodge. And then we also need places for people to reside. So we have recovery homes as well. Each one of these places are at different stages of development. We know that we will be able to open at the end of summer, early fall, but opening may be just opening our gathering place as well as our Healing Lodge and recovery homes. Our Friends and Family Connection Center will come later. So first, our gathering place. Our gathering place is situated right alongside the Penobscot River. It is sacred Penobscot territory, and we are fortunate to be able to have a piece of this amazing property. It's 45 acres. They have wooded campsites that we are renovating, as well as much space that could be utilized for both office space for our growing staff, as well as services that we're excited to be able to provide. What we know is that creating connections to the natural ways that we heal is something that, first, is very inexpensive, and second, very effective. And so these ways that we heal and connecting to our natural environment, being out on this property in our canoes and kayaks and incorporating our language, connecting to anything cultural is an opportunity for healing. And this is a beautiful property that will allow us to do that. One of the things that I mentioned before was our connection to food, our need for nutrition, our need to be healthy. And so our Naloxone program, or our abundance program, is situated here on this farm where we have raised beds as well as a 70-foot greenhouse and other gardens that not only will serve as an opportunity for people who are in recovery to heal through service and growing and watching other things grow, but also be able to eat and be nourished by this food. And this food will be not only delivered to the people within recovery, but to all of our communities. Being able to be connected to our traditional foods is something that is incredibly healing for people with substance use disorder and those of us who do not have substance use disorder. This healing is possible through food and celebration in our culture. And this gathering place is just the perfect place to be the home of this work. These are pictures of interns, our student interns, people who work in our areas of recovery, building the greenhouse. This greenhouse is now complete, I will say, and we're really excited to be welcoming every tribal chief and council to this property and be able to see the property now, which these pictures are just a few weeks old, but it certainly has been transformed. Our Family and Friends Connection Center, the building is down on the bottom that you can see. One of the things that we learned from traveling across the country that was critically important is connection to family during the time of receiving recovery services. So if somebody is in recovery services and needs to be away from their home community, that we have a place for their family to come to. When it is therapeutic in their recovery, that there is a place that their family can come to because there's a place for them. And not only is there a place for them, there's food for them because we have gardens on all of our properties. And not only that, we are looking at opportunities for childcare. We so desperately want to develop childcare, not just for our folks that may have family in recovery services, but all the folks in this town of Millinocket where we know childcare services are needed. Our Family and Friends Connection Center is something we're deeply committed to, but this project costs money, more money than the others. And so this project is definitely in our 2-year plan, but will not be opening this fall unless the resources come through. Our Healing Lodge. This property is where most of our services will be delivered. Your traditional recovery services that are offered at many places of recovery will be offered here. Again, this property is being transformed and looks very different than what you see here. And this is in the middle of the renovations. I will say, again, this looks different. What we wanted was wide open spaces. We wanted healing to be wherever people were. And if you needed to be inside, we wanted you to find healing inside as well. And what heals us, we want to bring with us. So we know that 45-acre property that is part of the Wabanaki Healing and Recovery Campus is just down the road, but where you receive services can be healing as well. So welcoming those elements of nature and still allowing the openness of the space, but also the privacy that's often needed when group or individual treatment, conversations, or therapy is occurring. We need a recovery home near these services. We cannot have treatment services away from our communities and not offer a place for people to live and stay while they're accessing services. So we recently purchased this building, this white building that you see. This will be transformed into a men's recovery home. Men will be living in this home, residing in this home, and have the ability to seek services right beside this home. So our Healing Lodge shares a driveway and parking lot, and their properties abut. So it is now one big property where we have the recovery home as well as the services provided right in the same area. Now, this is a recovery home for men. So we've built relationships with a local recovery home for women in Millinocket. Breaking the Cycle is an excellent, beautiful recovery home that serves women from across the state who need these services. We also have a partnership, and we work very closely with Breaking the Cycle to work with our Indigenous women. And we work very closely to make sure that this home is comfortable for all women, including our Indigenous women. This home, again, is not far from our Healing Lodge where services are provided. So we have a place for our women to be when they're accessing services just down the street. Our recovery home in Bangor is a home where we want to welcome people after they've received services, perhaps in Millinocket, or or whenever they're ready for this level of recovery home. This recovery home is a recovery home that's located in Bangor. It services Indigenous men, and we have Indigenous men living in this home right now. It is an amazing program. We connect the men in this program not just to recovery services and support their recovery, but connect them to employment services, making sure that whatever their goals are goals that we can stand behind them in accomplishing and helping them every step along the way. That continuum of care was mentioned earlier, that continuum of care of providing crisis support services and a crisis care line was something that we knew we needed to do. That again, going back to, we have a place for you, no matter where you are in your journey, there is a stop. There is a place where you will get a loving, supportive person on the other line to support you in the next steps. We were able to create this past year Wabanaki Care Line, the first ever toll-free care line that is a crisis line for Wabanaki people. We want to make sure that no matter where you are in the state of Maine, that Wabanaki people can offer crisis services, can access crisis services, and have somebody on the other end of that phone, no matter what time of day, helping them navigate the crisis that they're dealing with. This care line was so critical in this entire development of a campus for Wabanaki Healing and Recovery, because we wanted to make sure we were able to reach people even when they were in the grips of crisis. And this is allowing us to do so. Our critical incident stress management system, our CISM system that we are developing and have been developing and in the process of training. We have chiefs, vice chiefs, and many other community members involved with creating this system. What this is an ability to respond to communities that are in crisis. We know well that our communities lose our people far too young, far too often. And when we lose people, oftentimes our community is struggling. We wanted to develop a system that when our community is struggling, we can wrap around culture, love, and supports. We knew that having a strong continuum of care recognized that we will have crisis. We will have hard times, but having a system to respond and to travel to that community and wrap around those supports was something that we were able to develop in this past year. And this system was really, really supported by Chief Sabatis, who said, we need a system like this here for Wabanaki people in Maine. She has utilized this system from her Maliseet relatives across the border in Canada. And when her community was in crisis just a few years ago, she utilized this system from across the border, and it was critical in the healing of her community. And so because of her leadership, we were able to create it here. And we are pretty excited that this is a part of our entire system of care when we're talking about recovery and crisis. So future vision, this is where I'll stop. We have a lot of dreams. When we think about all of the things that our folks need to feel supported, loved, and have the conditions to heal, there's a lot. There's a lot in that continuum, and we're working hard to make sure that's done. Enhanced recovery and healing services. Detox is a must. Detox is needed in the state of Maine for everyone. We have a crisis in the state where we do not have enough detox beds. We want to develop one. We not only want to develop one for Indigenous people who need detox, but we recognize that many people need detox, and we want to be open to all. We're in the process of doing that development, planning for that development now. So again, this will come later. hopefully late fall of 2021, just this year. Equine therapy, outdoor and adventure connections are both important. We heard this from every treatment facility that we visited. Connecting people to the outdoors as well as animals has significant healing properties, and we're investigating opportunities for those. Skill and career development, we need to give people opportunities for their next step, whatever that might be for them. And we need to be ready for that, to support them in their dreams. And we're looking at opportunities for that now. Having women's recovery homes, we have a beautiful partnership in Millinocket, and we also know we need other Indigenous recovery homes for women. We are still struggling to meet the needs in our community, and this is an area of need, and we are working rapidly to begin to address this need. Our farming programs, connecting people to things that grow, is deeply healing. We know that, we've heard that, and we want to offer that in this program. Housing, not just recovery, we have issues regarding housing that puts our families at risk. We're looking at opportunities for expanding housing beyond recovery. And we're looking at diversifying our funding sources. One thing is that this work is expensive. It's costing money. And while we are really good at securing grants, we have to think beyond grants. We have to think, how do we create these services for as long as our people need them? For as long as they need them to heal, we need to offer them. So we're thinking creatively about opportunities there as well. I want to thank you, Chief Williwan, for the time today. I want to thank both Chief Francis and Chief Sabatis for your leadership from the very beginning. Wabanaki Public Health and Wellness is honored to be able to do this work, and we wouldn't be able to do this work without your leadership. So Williwan and Upchich. Thank you, Erica.
Thank you, Lisa, for your presentation. Thank you, everyone, for being a part of this presentation. Thank you, Chief Francis, for your words. Thank you, Chief Sabatis, for your vision. It's an incredibly exciting time. And with that, we close our presentation. And if you have any questions, my email as well as Lisa's email will be in the chat. And please reach out and ask any of your questions to either of us.
Good afternoon. I'm Jessica Pollard, and I have the pleasure of directing the Maine DHHS Office of Behavioral Health. And like last year, I have many tough acts to follow. I'll start with the housekeeping items. Everybody who registered for today's event will receive a copy of Erin French's book, Finding Freedom, that she discussed with Governor Mills this morning to start us off. Maine's Maternal and Child Health Substance-Affected Infants Virtual Conference for 2021, featuring keynote speaker Dr. Stephen Patrick, will take place September 28th and 29th. Registration opens in August. Emails with links will be sent out Monday, July 19th to the evaluation for continuing education credits and certificates, which will be sent once those evaluations are completed. Today was recorded and will be posted to the Governor's Opioid Response Summit and Seminar page, and we will email you once those links become available. Next year's summit will be live in person in Bangor on July 11th as a Penobscot County native. I'm very excited. We will be there next when seeing each other in 3D again. And between now and then, we will continue to host monthly seminar events, and we'll resume in September on the 10th for a webinar on naloxone distribution. And thereafter, the seminars will be the first Friday of every month, always at 11:30, always free, and with the offering of continuing education credits for a small fee. So today's theme for the summit of perseverance, prevention, and promise really resonates with me these days. We have accomplished so much, as you heard about today, and yet we are still losing friends, family, and neighbors every day. When asked how I'm doing these days, I've settled on overwhelmed but optimistic. We have an incredible influx of resources to dramatically increase and improve the help we're getting out there. From the millions of dollars to invest to changes at the federal and state level that remove barriers to harm reduction, treatment, and recovery. The supplemental budget, recently passed by the legislature with bipartisan support, contained $110.53 million in behavioral health initiatives, including $86 million in reforms proposed by Governor Mills. We thank the legislature for their collaboration. Combined with new federal funds and grants secured by DHHS, this gives us a truly unprecedented $234.18 million to invest in behavioral health, in recovery supports, in treatment, in workforce, in public information and education, reducing stigma, moving people to action, in harm reduction and prevention. It translates to meaningful differences made in people's lives. Parents struggling with SUD, substance use disorder, will be covered by Maine Care to help access services they need to bring families back together. These services may include the Maine Mom program we heard about today, or the 3 new evidence-based practices for parenting pregnant and postpartum parents being launched by Maine Care. And it means when a person is ready to stop using substances, beds will be available so we can strike while the iron is hot. Thanks to increased Maine Care rates and removing the 16-bed limit on residential facilities. That's a $4.5 million investment that will also make a real difference to substance use providers in ensuring sufficient workforce to staff these programs and making smart use of limited numbers of skilled nurses. It means that someone who is struggling and doesn't know where to turn will see or hear our options, Strengthen Me, or Eyes Open campaign messages and be connected to the information and resources that they need, including through our coming service locator tool. Putting these funds into action will mean fewer Maine youth will ever start misusing substances, thanks to the work of our prevention partners and our colleagues in the Department of Education. When our loved ones need a high level of treatment in the community, an intensive outpatient program will be there for them, supported by a nearly $20 million budget initiative. These initiatives mean when someone experiences the terror of witnessing the signs of an overdose, they will know to call 911, have naloxone on hand, and know how to administer it, and that the Good Samaritan law will protect them. That along with first responders, a trained substance use professional will show up to meet the person where they're at and connect them directly to harm reduction, treatment, and recovery supports. And they'll leave naloxone behind for the loved ones to have on hand should they need it. It means that Mainers from BIPOC communities will be able to access resources in the languages they speak and that incorporate their culture. Changes to laws and regulations mean that now, when EMS respond to a non-fatal overdose, they can leave behind naloxone so that support systems have the tools that they need to save the life of their loved one. Changes to law mean federal funding can be used to purchase fentanyl test strips, and barriers to distributing this resource in Maine are removed. Combined with public education, lives will be saved by the knowledge that any substance could contain the deadly fentanyl, and that people will be able to know and to have the resources to check their supply before using. These initiatives mean when someone is struggling with intravenous drug use, they can get access to clean syringes, saving lives and protecting health by reducing infectious disease risk. When a person working on their recovery needs a safe, supportive place to live, they'll be able to find a recovery residence that accepts and understands them, whether they be a member of a tribe, whether they be reentering the community from incarceration, or an LGBTQI person. They will build skills and relationship at their local recovery center. Today, we reflected on the importance of work in supporting recovery. We're thankful to have been able to create so many job opportunities for recovery coaches and to have initiatives on the way to bring more people into the behavioral health workforce. There is so much to do. It can get overwhelming, and it can help to reflect on progress made. Today, we heard many stories of success. I want to share a few more highlights to end the day. In keeping with the themes of connection we've been hearing about, our Strength in Me program has delivered over 50,000 supports, many of those through our community health outreach work partners. Today was also about the importance of sharing information. Our Strength in Me campaign, educating Mainers on resilience resources and treatment options through the COVID pandemic and continuing on after, has achieved 46 million impressions. We have been getting the word out to people directly through our new Spike Alerts program, as the first to go statewide in the country. Our Options campaign, which gets messages out regarding the risks of using alone and alternative strategies, information about the Good Samaritan Law and the importance of calling 911, how to access Naloxone and other resources, has achieved over 23 million impressions. In keeping with today's themes of meeting people where they're at and compassionate law enforcement response, I'm proud to give an update on the Options program that Governor Mills announced a year ago at the summit. We now have coverage around the state. With over just a few months of the program being in action, 241 substance-related calls have been co-responded to by a substance use professional, and there's been an increasing number of proactive referrals. So we know that when somebody has experienced a non-fatal overdose, they're at increased risk for a fatal overdose. So our Options liaisons respond to the scene and then follow up after the call has ended to make sure that a person is supported and connected to resources. And people can reach out directly to the liaisons for a referral to get proactive support rather than wait for the call to be made. We have received 262 such referrals and made 166 follow-up visits. Instead of arrest and incarceration, calls resulted in 122 connections to treatment, 132 connections to recovery supports, and 80 to harm reduction programs. And through Options, we've distributed an additional 254 Naloxone kits. In closing, I want to thank you for your time and attention today and every day for your hard work, courage in perseverance, prevention, and promise.